And again, I would like to welcome all the delegates in the third session of the fourth National Conference on Evidence-Based Ayurveda, organized by Ayurveda Teachers Association and accredited by MUHS Nashik. The topic of the third session is a unique topic, neurology, success and failure in treatment of knee joint. So to coordinate this session, I would like to invite the session coordinator. Our first session coordinator is Dr. Ankush Dikonwar, working as an assistant professor in Department of Rog Nidan and Vikruti Vignan at Datta Meghe Ayurved Medical College and Hospital, Nagpur. And second coordinator, Dr. Pradnya Kapse Madam. Dr. She pursued MS Ayurveda and PhD scholar and working as an assistant professor in the Department of Shalya Tantra at R.A. Poddar Medical College. Now, without wasting any time, I would like to hand over the mic to our session coordinator.
Good afternoon, all of you. Welcome everyone to the fourth National Conference on Evidence-Based Ayurveda, organized by Ayurveda Teachers Association, endorsed by MUHS Nashik. Morning session was very illuminating by respected speakers. Now we are going to start third session of the day. The topic of today's session, this session is a very unique topic, neurology. Neurology, success and failure in the treatment of knee joint disorder. As you all know, knee joint is the most complex joint of body which bears the maximum weight of the body. Along with this, due to lifestyle changes and due to degeneration, knee joint is the first to be affected. To diagnose appropriately, one must have complete knowledge of knee joint, including its anatomy, physiology. Let me clear you. If a male patient of 45 years of age comes to your OPD with a complaints of bilateral knee joint pain, along with this, if you add some other complaints, then your diagnosis will be changed. Same with others too. If one patient with any history of syphilis having knee joint pain, then your diagnosis will be changed. Today's speaker is going to focus some of these points in his lecture. So, our today's chairman for this session is respected Dr. Balaji Sawant sir. I would like to invite Dr. Balaji Sawant sir on stage. I think sir is not present here. Today's co-chairman for the session is Dr. Amit Paliwal sir. I request Dr. Amit Paliwal sir to please come on the stage. Dr. Amit Paliwal sir.
A very warm welcome to all of you in the afternoon session. The chairperson for today's session, Dr. Balaji Sopanrao Sawant sir, because of the personal problem, he could not come here. So, Dr. Amit Paliwal sir, he is here. He is our co-chairperson. It is my privilege to introduce him. He is MS PhD in Shalya Tantra. He is assistant professor in Bharati Vidyapit, deemed to be University College of Ayurveda Pune. He is having total experience of 12 years and he is ongoing research projects on his name, more than 2. He is having more than 22 scientific publications. He has attended various national and international conferences and workshops and guest speaker. He has visited to more conferences, more than 5. He is having his clinical experience more than 17 years and he is right now working as a consultant at Bharati Ayurveda Hospital, Pune and Pune Hospital and Research Center, Pune. So I would like to request Dr. Amit Paliwal sir to introduce our today's guest speaker, Dr. Mangesh Deshpande.
Good afternoon. I'd like to thanks ATA for giving me this chance to introduce Dr. Mangesh Deshpande sir. He is MD and having a good clinical experience in rheumatology. He is awarded as a Vaishagya in 2013 as a Doctor of the Year by Brahman Vaidyakiya Samiti, Dombivli. He is delivered as a speaker and guest lecturer in various national, international seminars. From March 2020, because of lockdown, he has started Shreya's e-learning platform for online Ayurvedic education. In just 2 years, he organized 25 organization and international remarkable seminars. Sir have Orthoved Hospital conducted fellowship course in Panchakarma, Shasutra Chikitsa and Rheumatology in Ayurveda. In the association of MUHS, Orthoved Hospital is the only institute in Maharashtra who has got the affiliation for the fellowship in rheumatology in Ayurveda. So with this brief introduction, I like to hand over mic to the organization.
Would like to call upon our guest speaker, Dr. Mangesh Deshpande sir, for his talk.
A 43 years old male patient comes to your clinic. You are asking his name. He stands up and immediately he screams, "My knee is paining suddenly," while getting up. What is the diagnosis? A 43 years old male patient comes to your clinic. Suddenly, while getting up, he is getting pain in right knee joint and he screams. This is homework for you. I am very much thankful to Ayurveda Teachers Association for inviting me in this beautiful seminar. I will be talking to you related to knee cases, 4 or 5 different knee joint related cases, clinical conditions. What is the diagnosis and what is the treatment? Let us start with case number 1. A female case comes to you. Say it is a case of 40, around 30, 35 years old. She comes to your clinic. She is wearing a tight mini skirt and with high heels. She comes to your clinic. She says, "My right knee gets pain while climbing up the stairs since 15-20 days." See, you can imagine the clinical picture of this beautiful lady. Tight skirt with high heels. She comes to your clinic. She says, "I'm getting pain." Where do you get pain? Anterior knee pain. She is having anterior knee pain at one particular point. There are 6-7 diagnoses related to anterior knee pain. This particular pain is known as patellofemoral pain syndrome. Because of tight clothes, the compression gets worsened. Because of, say, uphill climbing, she is getting pain and pressure at patellofemoral joint. And because of her age, at the age of 38, 39, because of her hormonal some imbalances, she is having slight osteoporosis also. Because of all these things, she is getting pain at anterior knee cap, that is patella. This particular pain is because of friction at patellofemoral joint line. And what is the treatment for this? This is a very simple case, and it happens with the patients who are traveling, who are frequent travelers, who works in AC offices, and who does no exercises or very less exercises. In this particular case, for first 8 to 10 days, we have to think of her pain management. How you are going to do pain management? Samir Pannag is a drug of choice for pain management in acute phase. For first 8 to 10 days, use Samir Pannag as a drug of choice for pain management, along with Mahavat Vidvans. Samir Pannag 62.5 milligram, Mahavat Vidvans 125 milligram. 3 times a day, along with, say, Dashamul Kwat. For 8 to 10 days, we have to give oral medicines, Samir Pannag and Mahavat Vidvans, along with Dashamul Kwat and Parishek of Sariva Kwat for 8 to 10 days. After 8 days, micro friction should be avoided for these 8 to 10 days. That means you have to tell her for rest, complete bed rest for at least 5 days. Then you can avoid the micro friction at that particular level. Sariva Parishek, Sariva Kwat Parishek will be giving her nourishment plus Samir Pannag and Mahavat Vidvans gives better pain relief. After 8 to 10 days, we have to give her some exercises. Exercises mainly related to quadriceps, mainly related to vastus medialis and vastus medialis obliquus. We have to give these exercises at least for 21 to 30 days. After 30 days, she will the VMO, that is vastus medialis obliquus, will get strengthened, will get tightened, and then she can walk easily. This particular movement is associated with quadriceps. You have to tighten her quadriceps. You have to strengthen her quadriceps at least for 30 days after pain relief. And then after 30 days of this management, her pain will get relief, her swelling will get reduced, she can walk easily. And after 30 days of this particular management, go ahead with Rasonak Shirapak at least for 2 to 3 months. This will be Rasayan for her clinical condition. See, these particular things will increase with squatting, knee bend, and if you are overusing staircases. So you have to tell her about avoiding of these movements. This is case number 1. This is extra articular cause of anterior knee pain. This is not at all osteoarthritis of knee joint at the age of 35, 37, 38. So beware of it. It will completely get cured with the help of only Ayurvedic management. If she is doing, say, flexed knee, it is related to, if you are doing flexed knee, mandi halun basane, and then you are getting pain, it is because of tight quadriceps. If it is sitting crossed legs, it is tight ITB. If iliotibial band, if it is related to pain walking down hills, then it is related to muscle leg issue and it is related to gluteus muscles. If it is related, pain is related to down uphill walking, then it is because of tight calf plus gluteal muscles. If it is related to tight clothes, I told you about compression forces are there, because of which patient will get pain. So you have to tell the patient accordingly. Hetu, you have to find out exact hetu of pain, and then you have to manage the patient accordingly. This is case number 1. If pain is during the activity, if she is walking and if any patient, he is walking or she is walking and they are getting pain, it is related to biomechanics. If patient is getting pain after 1 day, then it is always inflammatory samprapti. If patient improves in pain with exercise, then it is related to mainly ligament or tendon related pathology. If you tell the patient to do specific exercises and he gets improvement in his clinical conditions like pain, swelling, etc. If he is improving with that, then the samprapti is always related to tendon or ligament. In these particular cases, exercises, role of exercise is very important. Role of particular muscle pumping is also very important. So anatomy is important. With the help of good anatomy knowledge, you can solve these type of cases. Now I'll come to second case. A patient of say 25, 26 years old, again a female case, comes to your clinic. She says, doctor, I'm getting pain anteriorly only, but along surrounding knee pain is also there. A female of say 18 years comes to you saying pain in and around kneecap, knee joint, around patella. What is the diagnosis? There is no history of trauma. There is no history of any fever. There is no history of any other disease, like say tuberculosis or anything else. There is no history of any surgery done. In this particular complaint, you have to just check this patient, like you have to press her patella at apex level. You have to press it at apex. Apex is distal part of patella, and let the patient extend her knee joint completely, full extension. If you get crepitus sound, this type of sound, can you hear this sound? If you get this type of sound, and if you feel this sound in your palm, then this diagnosis is known as chondromalacia patelli. This is posterior side of patella gets malnourished because of say lack of blood supply, or because of anything else, because of say excessive friction, because of say osteoporosis and whatnot. Because of this, the posterior side of patella gets malnourished, gets weakened, and while climbing up the stairs, while moving around, while walking also, patient gets pain. Chondromalacia patelli gets at the age of 15 to 30. At the age of 15 to 30, and mainly in females, it is related to nourishment, and the main treatment in this is pichu. Pichu related to say Mahamash tel. You can apply that Mahamash tel. You can put a pichu for 20 to 25 minutes daily, at least for 20-21 days, and you will get good results. What for pain? Again, Samir Pannag is a drug of choice. Why Samir Pannag? See, in Kafasthan, Sandhisthan is a Kafasthan. In Kafasthan, if cough is vitiated, if the symptoms are related to cough, then use Rasa Sindoor as a drug of choice. If in Kaphasthan, Vata Dushti is there, Vata Vruddhi is there, Vat related symptoms are there, Vat vitiated symptoms are there, then use Samir Pannag as a drug of choice. I'll try to simplify it. How? If you get a patient of, if you get a patient of, say, bronchial asthma, Shwas, Tamak Shwas, if you find sounds of Kapha Vruddhi, then use Rasa Sindoor as a drug of choice. If you find sounds of whistles, Vata Vruddhi, then you can use Samir Pannag as a drug of choice. Same thing, same principle in knee joint also. If you find Shodh, if you find cough related symptoms like Gaurav, then think of Rasa Sindoor as a drug of choice. If you find Shul, if you find Crepitus, then use Samir Pannag as a drug of choice. I'll again come to one case with that. Again, a patient of, say, age 55 comes to your clinic. He is a male patient. He comes to your clinic. He says bilateral pain in knee joint is there. Sudden onset of knee pain is there. There is no history of pain previously. He is not a hefty patient. He is lean or moderate type of personality. There is no history of rheumatoid arthritis in his family. What is the diagnosis? This is known as pseudo gout. Pseudo gout. In this particular case, there are two types of crystals. One is CPPD, it is known as. One is related to cough and one is urate, that is related to pitta. If it is related to uric acid, it is known as gout. If it is related to CPPD, it is known as pseudo gout. In pseudo gout, mainly it is bilateral. Mainly it is bilateral with no history, no previous history of pain. If there is pain related to pseudo gout, please give treatment related to cough. Kaphagna chikitsa is important in these type of cases. So what will we use? In pseudo gout, please use Rasa Sindoor as a drug of choice along with Devdar. We use Rasa Sindoor and we use the Rasa Sindoor 62.5 milligram along with 500 milligram of Devdar 3 times a day, at least for 10 to 15 days minimum. I use Rasa Sindoor daily for up to 30 days also in very small quantity, not in 62.5 milligram. Then I reduce the quantity also. Anyway, I was talking about Chondromalacia Patel. In first step of Chondromalacia Pateli, first step of treatment in Chondromalacia Pateli, you can start using Samir Pannag along with Ekangavir. Why Ekangavir? In flaccid muscles, when muscle gets flaccid, use Ekangavir. If they are there is muscle wasting, then use Mahavat Vidvans. You can go and please read the text or the shlok of Mahavat Vidvans and Ekangavir, then you will come to know about it. In this particular Chondromalacia Pateli, please use Dashanga Lep along with ghee, along with Ghruta for local application at least for 8 to 10 days. In second step, after say 8 to 10 days, when severity reduces, severity of the symptoms gets reduced, then use Gandhatel, capsule Gandhatel along with Lakshadi Gugul as a drug of choice at least for 20-21 days. You can get capsule Gandha tel of many South companies, and it has very good result for Abhyantar Snehapan. Gandha tel is used in Bhagna Chikitsa. I use Tiktakshir Basti once a week in these type of cases for a longer period of time. The third case. Third case, a patient comes to you, say of age 40, female, comes to you and says, I am getting pain along with swelling. There is a huge swelling on patella, but the swelling is slightly softer when you touch it. These particular uh, uh, this particular swelling is known as bursitis. Bursa. It is situated between tendon and a bone, and it reduces friction in these two particular components. So, bursa gets infected also, or bursa gets swollen also. In 20-25% of cases, bursa gets infected, and in 70-80% cases, bursa gets only inflamed. In this particular case, this is known as housemaid's bursa or Popeye's, Poppeye, Popeye's knee. In this particular case, you get bursitis at anterior knee joint level. So there are suprapatellar bursitis, prepatellar bursitis, infrapatellar bursitis, and pes unserine bursitis. There are mainly 4 types of bursitis. Mainly, it is seen in housemaids' knee. Mainly, housemaids sit on their knee, and then they start doing washing or anything else and gets swollen bursitis. Sanghvi sir, namaste. So, there are 4 types of bursitis: suprapatellar, prepatellar, infrapatellar, and pes unserine bursitis. If a middle-aged patient comes to you saying he is having inferomedial, you can put your hand at the inferior and medial part below, just below 2 centimeters of knee joint. There you will get insertion of sartorius and gracilis and semitendinosus. This particular area is known as pes unserine. At that particular level, you get a swelling along with redness, along with pain while palpating. This particular bursitis is known as pes unserine bursitis. Many a times, it is mimic with osteoarthritis of knee joint. So beware of it. This is just plain bursitis. If you get bursitis, then start doing Agni Karma along with Haridra Kanda. Haridra Kanda Agni Karma has got very good results in bursitis. After that, after say 4 or 5 days, daily you have to do Agni Karma for 4 to 5 days. Pain immediately reduces. After 5 days, start applying lab of say Dashanga lab along with Gruta. Why Gruta? 1/5 of Gruta has to be taken along with Dashanga lab. It is told in our texts. So along with Gruta, it gives good results. Mainly bursitis, mainly it is seen in male patients and mainly in 40 to 60 age group. Trauma, frequent falls are the main causes, main vatacha causes of this bursitis. If it is very easy to treat, bursitis is very easy to treat, but it is difficult to pinpoint it. It is difficult to diagnose it. It is very easy to treat. But if the bursitis is red, hot, swollen, then please exclude infections. If it is related to infection, then it is very difficult to treat with the help of only Agni Karma. Then don't go for Agni Karma, do something else for the better treatment. Agni Karma will fail in infective bursitis. A patient of say 25 years, अजून 5 minutes, 5 more minutes. A marathon runner comes to my clinic. He is of age 28. He says, now I can't jump. I can't jump for a long distance. And since how many days? Since 45 days, I can't jump. Okay. Other activities, no problem. I can run also, but I can't jump. So what is the diagnosis? Other activities, no problem. Only I can't jump. No long jumps. So there is a patellar tendon, apex of patella and tibial tubercle joining, and there is a tendon, apex of the patella plus tibial tubercle. There is a small tendon which is known as patellar tendon. This gets affected mainly in case of runners. It gets affected. If it gets affected, patient goes to orthopedic surgeon. If patient goes to orthopedic surgeon, orthopedic surgeon says, you have to take intra-articular steroid injection to reduce the inflammation. Okay, patient takes intra-articular steroid injection, and after 1 or 2 injections, the tendon, the size of the tendon image starts thinning. Size of the tendon gets reduced because of that steroidal injection, and patient gets patellar tendinopathy. In this case, you have to give Snehapan, Abhyantar and Bahya at least for 40-45 days. Then only you get good results. Along with Snehapan, we have to give, along with Abhyantar and Bahya Snehapan, we have to give some physiotherapy exercises also for better results. A patient of say 7-8 years, male patient, comes to your clinic. He says, my knee pains. Remember one thing, in orthopedics, if a patient of say 10 to or say 5 to 15 age group comes to you in orthopedics, then beware, there must be a serious cause. There must be a serious cause, and we have to thoroughly examine the patient. The small child says, I get pain in ankle. He says like this, I get pain. You have to examine his ankle thoroughly, and then you come to know there is no knee pain. It is just below knee pain, just below knee, just 2 centimeters below knee. There is tibial tubercle. At that particular area, if you press, the child screams. He says, I get pain at this particular area, don't touch that area. This is known as apophysitis. This is again a sort of malnourishment of that particular bone, malnourishment of that tibial tubercle, apophysitis of tibial tubercle, for which you have to give treatment related to treatment associated with Bhagna Chikitsa, and then you get good results. This particular clinical condition is known as Osgood-Schlatter disease, or say apophysitis. It is commonly seen in heel also. If a small child comes to you with heel pain, it is not plantar fasciitis, it is not parsonage, It is not tendinopathy, it is not bursitis, it is apophysitis. It is related to bone. It is not related to tendon, it is not related to fascia, it is not related to anything else. So, accordingly, related to it, you have to treat the patient with Asthivah Srotas Chikitsa, mainly Tiktakshir Basti. So, I just take a brief of some X-rays related to it. Excuse me, sir. Next slide, please. Next slide. Next. See, these are some components: bone, cartilage, muscle, ligament, tendon, and bursa. And skin also. There are 6-7 components related to knee joint, which can be affected. Next. Acute injury evaluation and specific indications. Next. Blunt trauma. In acute conditions, knee X-ray is a must. If a small kid comes to you with knee pain, knee X-ray is a must. Next. If a patient of, say, patella, 55 years old, more than 55 years old with trauma comes to you, X-ray is a must. See, in radiology, alignment, then B for bone, these are main components. So this is genu varum and genu valgum, bow leg. It is mainly related to osteoarthritis of knee joint. Next. And congenital abnormalities. This is subluxation. In this particular case, if a patient, say male patient of say age 10 to 15 years old at 2 a.m. calls you up with screaming, says my knee is paining, 10 to 15 years old, then acute pain is there, 2 a.m. Then it is patellar subluxation. Mainly in these cases, you have to immediately admit the patient. Next. This is A for alignment. This is B for bone. These are some spurs. You can see it. Osteophytes, you can see this. In osteoarthritis, always there is one compartment loss. In rheumatoid arthritis, both compartments are similarly lost. In osteoarthritis, only one compartment is lost. Next. This is osteochondritis dissecans. If you get these type of bone pieces in knee joint, if it is more than 8 to 10, then go for surgery. If it is below 8 to 10, then you can think of your internal medication, but it won't get dissolved. Still, patient will feel good, but the bone pieces will not get dissolved. Next. See, this is fracture of patella. Next. This is very important fracture. This is known as tibial plateau fracture. Many a times you won't get this diagnosis in plain AP or lateral X-ray. You have to go for CT scan. Then only you will come to know about tibial plateau fractures. Many a times we can miss this type of fracture. In this particular fracture, you have to go for surgery only. Don't tell patient just for go and do some cast or do some plaster. In this tibial plateau fracture, you have to go for surgery. Then and then only patient will get very good results. Next. This is Osgood-Schlatter disease. You can see this tibial tubercle. At that particular area, you can see the fragments of the bone. This is known as apophysitis. It is malnourished and it is not fused right now. Next. This can be completely healed with the help of Ayurveda. This is tubercular knee. Next. Next, I told you about this. See, this is osteoarthritis of knee joint. You can see the changes related to X-ray. Next. This is rheumatoid arthritis. See, alignment. This is symmetrical loss of the medial and lateral compartment. Symmetrical, if it is symmetrical loss, it is rheumatoid arthritis. If it is asymmetrical loss, it is OAE. Next. Osteoporosis. You can see thinning at end point of knee joint of bone. This is known as osteopetrosis. Osteopetrosis is related to a systemic disorder. This is also known as marble bone disease. Marble is quite harder, but it is fragile. If you put it down, then it cracks. Like that, bone is like that. This is known as osteopetrosis. Next. Osteomyelitis, very dangerous, and you have to diagnose it thoroughly. Don't miss this type of diagnosis. Next, you can see the cavity. Next one. Mainly tibial plateau fracture. You should not miss this type of diagnosis. One. Next. What is the diagnosis? Subluxation. Right. Next. Alignment is not proper, so it is subluxation. What is the diagnosis? Osteopetrosis. Next. Rheumatoid arthritis. Next. OCD. Osteochondritis dissecans. Next. Osgood-Schlatter disease. Next, this is just a revision. These are questions to be asked to audience, but right now audience is in the lunch. So next, tibial plateau fracture. Next, this is very important diagnosis, huh? And each and every clinician will come to this type of diagnosis, TB knee, tuberculosis knee. So these are some X-rays which I told you about or described to some extent. Because of lack of time, I was given all 45 minutes. So I could complete my lecture in just 44 minutes. So thank you very much for patient hearing. It is very difficult to talk in between lunchtime. So I'm thankful to these respected personalities also, and thanks to all of you. Thank you very much.
Hello. Yeah. We have heard a very unique concept from such an eminent personality. And sir, physically the audience is taking lunch, but more than 1,500 viewers are there who are watching your lecture from YouTube and Facebook. So all the inputs and feedbacks we are getting. Neology, it is a unique word or expression for the study of knees and discipline of what we should do to keep our knee joints healthy and active. So today's session was a beauty to understand the beautifully structured joint to hold the boot together. So I will be thankful to you, sir, for taking your valuable time and coming here to guide us. I will request today's co-chairperson, Dr. Amit Paliwal, sir, to please share his views about today's lecture.
Uh, I like to thanks Dr. Deshpande sir for giving a precious opinion on the osteoarthritis with so many diseases on knee joints, with pathophysiology and the line of treatment, that is medications, and the good physician is who avoid the surgery with the medicine. This is a good opinion. I like to add some things regarding these things. In infected bursitis, there is a good, we can make a rectomokshans in some arthritis, or like the vatrakta, we can make a jalovkaucharan, etc. We can add these things into the line of treatment with this additional in the treatment modalities. With this, I like to thanks the respected sir and the audience. Thank you.
I'll request co-chairperson, Dr. Amit Paliwal sir, to please felicitate our today's guest speaker, Dr. Mangesh Deshpande sir. I'll request Dr. Sandeep Jadhav sir, National Executive Member of Ayurveda Teachers Association, to please felicitate our today's co-chairperson, Dr. Amit Paliwal sir. With this, I conclude that today's session is over. Thank you so much.
Third session is over, and I request the session coordinator of the third session, Dr. Pradnya Kapse ma'am and Dr. Dikonwar sir, to please stay on the stage and come on the stage. I request Dr. Sandeep Jadhav sir, Executive Committee Member, Ayurveda Teacher Association, to please felicitate our today's session coordinator, Dr. Dikonwar sir, Dr. Ankush Dikonwar and Dr. Pradnya Kapse ma'am, for conducting this entire session very nicely. Thank you, Pradnya ma'am, and thank you, Dikonwar sir. Now moving to next fourth session. The topic of fourth session is role of Rasaushadhi in diabetic complications. I invite the session coordinator, Dr. Rita Mandle ma'am, MD PhD scholar, Assistant Professor, Sumatibai Shah Ayurved Mahavidyalaya, Hadapsar, Pune. I request Dr. Pallavi Pardeshi ma'am, MD in Dravya, presently working as an Assistant Professor in the Department of Dravya Vignan at Bhimashankar Ayurved College, Vadgaon, Pune. I request both of the session coordinator to take the charge of the next fourth session. Thank you. Thank you, ma'am. Good afternoon, all of you. Myself, Dr. Rita Mandle. As we know that today's topic of the session is role of Rasa Aushadhi in diabetic complication. We know that diabetes is a chronic metabolic disease, and it is a condition that impairs the body's ability to process blood glucose, which result into
serious damage to the major organs and leads to the complications like diabetic retinopathy, neuropathy, nephropathy, and all. Over the past few decades, it is observed that both the number of cases and prevalence rate of diabetes is increases. So it is necessary to find out the cause and it is necessary to do the proper treatment for this. So it is a great opportunity for all of us to get insightful knowledge and experience from our renowned speaker. For this session, our chairperson is Dr. Shailesh Deshpande sir. He is a professor of Department of Kai Chikitsa, Ayurveda College, Vadodara, Gujarat. But due to some reason, sir couldn't attend this session. So I welcome that sir. And for further proceeding, I invite my colleague Dr. Pallavi Padesi ma'am. Ma'am, please. Thank you.
Thank you, Rita ma'am. First, I am very thankful to organizing committee to give opportunity as a session coordinator in fourth conference on evidence-based Ayurveda organized by Ayurveda Teacher Association. It's my great pleasure to give a short introduction to today's co-chair person. I would like to welcome Dr. Amit Pawar sir. Welcome, sir. Here I give some introduction about Dr. Amit Pawar, sir. Sir is presently working as an associate professor and HOD in Department of Ayurveda Pharmaceutical at Rural Institute, Ayurveda College, Maini. Sir completed BMS from RCA College, Belgaum. MD Ayurveda Pharmaceutical from Bharati Vidyapeeth, deemed to be university. Diploma in Yoga and Ayurveda. Postgraduate Emergency Medical Services, Rubiol, Pune. PhD scholar at Bharati Vidyapeeth Deemed University, Pune. Topic is on anxiety and depression. His academic experience around 9 years. He has been working in Maharashtra University of Health Science, Nashik, as a senior examiner for UG courses since 4 years. Dr. Amit Pawar sir working as an Ayurveda consultant at Shatayu Ayurveda Hospital, Vita. He had published total 7 research articles in national and international journals. He had also delivered 10 educational lectures in different institutes. Thank you, sir, and welcome again for co-chairing of today's session. Now I would request our today's co-chairperson, Dr. Amit Pawar sir, to introduce our eminent speaker, Dr. Sanjay Khedekar sir.
Thank you, Dr. Pallavi, for kind introduction of me. And thank you, Dr. Rita, for coordinating me for this session. Post-lunch session, very difficult, as earlier speaker told. But viewers are more. And Asya Sukham, Swapna Sukham. In diabetes, so diabetic complications. We are seeing the diabetic complications in today's era. I'm here to introduce one versatile personality and working in this era since I think around 10 years. Dr. Sanjay Khedekar sir is a leading Ayurvedic physician in the neurological disorders, cancer and diabetic related complications. Along with this, he is the best academician, researcher and manufacturer of Ayurvedic medicines, different Ayurvedic medicines. He is one of the decorated research fellow in the Ayurveda drug research field. He is one of the few scholar personality that he completed his UG, post graduation and PhD with merits, that is first rank and gold medalist also, uh, with a reputed institute like Jamnagar, Gujarat University, Jamnagar College. Um, Also, he received international awards, two best feature research papers, presentation award at South Korea, international award, and national award in CCRAS, best research award in 2016, which is Ayurvedic Science, Ministry of Ayush, Government of India, Ministry of Ayush, Sri Shripadji Naik felicitated him this award. Also National Award as a Rasa Acharya Award. He received National Award like, he was pleased with gold medal, Dr. Hari Shankar Sharma Gold Medal awarded for the extraordinary contribution and best performance in the drug development field of Rasashastra, and first rank by Gujarat Ayurveda University, Jamnagar in 2009. He has so many achievements, but we are lagging time, I'm just finishing. A few glimpses. He monographed scientific report submitted to Ministry of Health, Government of India, detailed the project report of the pharmaceutical standardization of preparation of Bhasma and Kalpa. Also, his topic of MD and PhD based on Swarna Bhasma and Makar Dhwaja. These two Bhasmas play very important role in diabetic complications and diabetic management of diabetic patients. So, without wasting time, I would like to invite our eminent speaker on dais, and session is yours, sir, and all the best. Thank you, sir.
Thank you, sir, for kind introduction. A warm good afternoon to all of you. This is the post-lunch session, so I can understand your feelings and also gut feelings too. We are lacking with time, I know also it. So basically, I am very much thankful to Ayurveda Teachers Association for inviting me as a guest speaker for this session. Topic is entitled Role of Rasa Aushadhi in Diabetic Complications. So we know, all of us knows that diabetic complication and diabetes both are a very versatile disease and disorders. Nothing can be this is a collection of a disease actually. So we can't consider it as a one disease or a single disorder. These complications are very complicated things. So slide this. Next slide. So these are the basic causes. We know that Navanapanam, Guduvai etc., etc. But one is important cause was mentioned in the text, that is Havi Prashat Prame Kushtana, Charaknadan. This is again a very important cause behind the diabetes or behind Prameha, behind Madhumeha. See what the classical texts have mentioned, like Prameha, and after years of in the Prameha, it get converted to Madhumeha. This concept is different from today's diabetes. We have to consider it as a diabetes or hyperglycemia. We can correlate it to our classical considerations of Madhumeha, Prameha, etc. But basic ideology behind the consideration or behind the correlation with diabetes with Madhumeha or Prameha is different. Here, there is a mixing of many Siddhantas, classical Siddhantas of Ayurveda. So, next slide. These are the actually Nidhanas of the Vatajmeha according to Chakrapani. Next slide. Next. We directly go to the complications, diabetic complications, so we can do with time actually. Next slide. This is the actually Avruttavad and diabetes complications. The correlation between Avruttavad and today's diabetic complication, we can consider it here. भिन्न आम श्लेष्म संसृष्ट गुरुवर्च प्रवर्तनम श्लेष्म सौरुत्य apane kapameyasya chagam. It's actually like it was mentioned in the Charak Chikitsa 28 in Vata Vyadhi that kapameya, and if apan avrutta kaf is there, it can be correlated with kapameya. So next slide. This is actually the today the theme behind the diabetic complications and the relation with correlation with today's diabetes. Prameha in Amvat treatment, they have mentioned that Prameha Vata Medugni Amavate Prayoje. So Charak is a very clear with his treatment protocol. At that time, he mentioned that we have to choose the protocol, treatment protocol of Prameha, Vatahar, Pramehar, and Medagna for the Chikitsa of Amvata. So today we can consider the basic relation between today's diabetes and diabetic complications with more with Amvata, more with Ajirna, more with gastric disorders than Prameha and Madhumeha. Next slide. Next slide. Please, previous one. This is the just diabetic complications according to Charak Samhita, that is complications of Prameha. It was mentioned directly that Upasarga, Trushna, Shosha, Jwarameha, Shaya, Shosha, etc. were mentioned in the text. Next slide. Next slide. Next. So, complications of diabetes according to the modern science are, it's a very vague topic. There are macrovascular, microvascular complications are there. So neurological complications are there. So basically, under this heading, there are many minor disorders which are actually which have major complication in diabetes. So let's see here evidence-based criteria which I have followed for the treatment protocol. Next slide. See the cases, first mucormycosis, and then we will go one by one. This is the first case of mucormycosis. Actually, these are the mucormycosis was developed in between last 2 years due to the COVID. But major thing was that the many patients having found that they have previously diabetes or diagnosed diabetic at the treatment during the treatment of the COVID or after the COVID. So what happened in this case? It was a rhinocerebral mucormycosis actually, and in this case, patient having diabetes from 11 years. Patient was female patient, 44 years old, and having weight of 57 kg. Patient's back history, that is of previous history, he showed that the patient having Ajirna and Chitta, etc. So recent history, medical history was COVID-19. Next slide. Mucormycosis was patient. This patient was diagnosed before 4 days. When patient came toward us, before 4 days, patient having diagnosed with the mucormycosis, and patient having uncontrolled diabetes followed by the modern system of medicines. It means the patient having modern line of treatment was there, but during that treatment there was recovery signs were very few. So patient adopted for Ayurveda treatment, and we started to treat with Ayurveda. So basically, what happened here during the treatment protocol, we have decided that mucormycosis in the mucormycosis is here we are considered as a complication of diabetes. And according to Ayurveda, we have treated it. So the basic pathophysiology related with Ayurveda is a kotha formation. We can say it is a kotha, or we can say it is a paka process was there, and degenerative process is also there, but it is an acute condition. So for this acute condition, we decided for Rasa Aushadhis. Next slide. And for diet purpose, we have given patient having uncontrolled diabetes. So here we choose for camel milk, and next was a langan. With langan, we are given only camel milk. Why camel milk? According to Ayurveda, there are 9 to 10 types of milks were considered as a milks, and in all these milks, only camel milk having the property of krumihara activity. Another thing, it was a Ishat Lavan, Kruksha and Ushna property. So for this purpose, and also some modern medicine, modern claims are there that camel milk having anti-hyperglycemic activity too. So for this purpose, we started with camel milk as a diet for this patient. 1 to 2 liters of camel milk was consumed by the patient for a day, and along with that, another no any food was given to the patient. And the type of medicine we choose for here, that was a Siddha Makar Dwaja, Mukta Pishti, Swarna Samirpanna, Swarna Bhasma, Tamra Sindur, Tamra Bhasma, Somal Bhasma, and Hartal Bhasma. Why we have chosen the Siddha Makar Dwaja? Because the Swarna Kalpa was having the best action for the Garavisha. And the Charaka Samhita for Garavisha, he has quoted directly for Swarna. The best product for a Garavisha is Swarna. Another thing, in the mucormycosis, we also consider it as a Garavisha, but Garavisha with acute intensity. So for this purpose, we choose here Swarna Kalpas, basically Siddha Makar Dwaja and Swarna Bhasma, both having the best action for regenerative process. The regeneration was mentioned in the text, in the classical text of Shastra, that Swarna Bhasma having activity to give new generation of the cells. For this purpose, we decided for Swarna Kalpas. Another thing, the Somala or Somala Kalpas were here also given, because the Somal having the quality that it can be transferred, or it can be easily uh, reached to Asti Dhatu, that is bones, or bones, it can be reached easily than any other medicine. So for this purpose, we choose Somala, because in these patients of mucormycosis, we have seen that it can patient having complaint with the nasal area, cartilages of the patients having deteriorated, degenerative conditions appears in the patient within 2 or 3 days. So, and then after 2, 3 within 2 to 3 days, it can be transferred to the optic nerve, and from optic nerve to the cerebral cavity. So for this purpose, in this acute condition, the medicines which having fast acting properties, for this purpose only we have added Somal Kalpas. And Tamra Bhasma having action with the liver conditions. So all of these medicines, Rasakalpas have started within 3 to 4 days. Previous slide. Previous slide. So previous slide. Previous slide, back slide. Bus. So you can say that the first picture was a patient when we have started the treatment. At that time, his optic nerve was involved in the pathogenesis, and according to modern medicine, she was instructed for operative of that for that purpose, and removal of one eye. At that time, we started the medicines, and within 3 to 4 days, we got extraordinary results. The patient's edema at eye was found decreased, and within 7 days, patient's eye was found normal. She got the capacity to visualize as per normal person's visualize. So this is that achievement within 7 days we have achieved in the mucormycosis case. For this, next time. Next, okay. See here, the role of Siddha Makkar, Dwaja and Swarna having upper hand in the treatment purpose. Next was the Samir Pannak and Somal Basma was also useful, found useful. And these medicines were given in the priority base. It means if we got the result within 3 days, we stopped Makkar Dwaja and Swarna Basma, and we have started Mukta Pishti and Tamra Basma here. The basic reason is that the regeneration process was started and the growth process was stopped. For that purpose, we have stopped the Somal and Swarna Basma and started for next 4 days Mukta Pishti and Tamra Basma. And also some herbals were also adopted here. Sarivara Senchurna, Rasna, Amalki, Pipli, Estimadu, Jatamansi, Patol, Haridaki, Karkashungi, Pushkarman, Ashwagandha. According to timely, these mixtures were changed according to condition of the patient, according to the improvement in the symptoms and improvement in the status of the patient. So aggressive treatment was given for the 1 month. After 1 month, the Rasayan treatment for next 6 months was given. Patient is comfortable with him without any operative was there. Patient is very comfortable right now and don't have any signs or any symptoms of the mucor and also one thing is there, patient's diabetes which was uncontrolled before treatment also or before mucormycosis also, now she is having completely controlled diabetic condition. Next slide. Next slide. This is the second case of mucormycosis, where the patient's age was 54, having sedentary lifestyle and having teacher profile. History of diabetes from last 12 years, recently diagnosed with hypertension is also there, and the recent medical history was COVID-19 positive. Next slide. Mucormycosis was diagnosed before 33 days. It was a chronic case of mucormycosis, but he was treated with allopathic medicine for more than 30 days. And during the treatment process, the patient having uncontrolled diabetes, followed by modern medicines also. So, and also during the 30 days, patient having operated for 2 times with rhinoplasty surgery. Third time recurrence within 1 month, and also there was a recurrence of complete mucormycosis within third time within 1 month. So this time the rhinocerebral and the optic nerve involvement was found. This is the first picture was the patient's after 1 month of the mucormycosis, and the second picture is after treatment. Before treatment picture was there, and also second picture is after treatment. So you can see that the patient's condition is completely normal after the treatment of Ayurvedic treatment. Here, next slide. Here we choose again the same protocol, that is camel milk and langan for 1 month was given. Then the medicine like same Siddha Praval Pishti, Mukta Pishti, Swarna Samir Pannak, Swarna Basma, Tal Sindur, Mallar Sindur, Tamra Sindur, Tamra Basma, Somal Basma, Hartal Basma, and remaining medicines also there. Here one more medicine was added, that is Asti Sandankar Grita. For around about 1 kg was consumed by the patient for 6 months. The reason behind Asti Sandankar Grita is that patient having rhinoplasty surgery and his cartilages were nasal cartilages were degenerated or removed during the surgery. So for the improvement in that condition, post-surgical condition or the degeneration of the cartilages, Asti Sandankar Grita was added for the treatment. And we found very good results during this treatment in the patient after the treatment. Why these medicines again was mentioned here, medicines have used, Prolapishti was used because of patient having cartilages issue. So to bring cartilages back to normal level or to get improvement in that cartilages, we have added Prolapishti here. Remaining medicines are same like previous case. because the Makar Dwaja and Swarna having again very good property for regeneration of the nerves and regeneration of the cells, and we have seen this result from last 10 to 15 years from right from my PG days, that Makar Dwaja having a very good regeneration capacity. So with that confidence, we have started Makar Dwaja and Swarna Bhasma here also. Here again, for 2 months, we have started aggressive treatment, and then for 6 month follow-up, we have started Rasan treatment for the same. In the Rasan treatment, we have used Mukta Pishti, Praval Pishti, and sometimes Siddha Makar, sometimes Swarna Bhasma. For aggressive treatment, we have in the aggressive treatment of the mucormycosis, we have to change the regime of our medicines on daily basis, because if we don't, we have to treat this condition as an emergency treatment, because patients are hospitalized that time, and we have to change the medicines course daily based. So if we got improvement in some signs, like that patient is saying that yes, I got today nasal secretions are decreased, so we change our medicine protocol for next time. That is, we need to change for inflammatory process. For next day, we have added the medicines for inflammatory process. Like see, Samir Pannang having good action, Swarna Samir Pannang having good action for nasal secretions. But to remove for the inflammatory procedures, Tamra Sindura, or Tala Sindura having good action for the inflammatory process. So for nasal secretions, if we add Swarna Samir Pannak, if we get improvement in the nasal secretions, we stop the Swarna Samir Pannak and add the Tamra Sindura or Tala Sindura as per the requirement. So in the aggressive treatment protocol, here we need to think like as emergency medicine. We need to change the regime on daily basis. Even I can say that we have to change the medicines. If we in the morning we give some other medicines, according to the condition, we have to change the medicine for the evening or for night. So basically, these types of cases in our lifetime, we treat very few cases like this, or we got opportunity to treat these cases in. Luckily, we get these cases. I can say that. So at that time, we need to think like we are emergency practitioner. We have to think like a ICU interventionist or ICU physician who is working in the ICU. So here just which medicines I have used for the treatment protocol were mentioned, but not on which daily basis we have changed the medicine protocol was not mentioned here. Next slide. So this is the actually condition of the patient. The previous is before mucormycosis, the patient faces there, and after treatment, patient having get very good recovery. I can say that he is more better than previous condition. Next slide. So what is the time? So next case is a diabetic foot condition. Patient was 74 years old, weight 64 kg, sedentary lifestyle, teacher profile, Pitta Pradhan Kapha Prakruti, DM from last 32 years, recently diagnosed with hypertension, recent medical history again COVID-19. And after COVID-19, there are many cases of these types of cases are there, like mucormycosis, diabetic foot, diabetic ulcer, etc., etc. were found. Next slide. Diabetes foot was detected before 6 months, but patient was treated with the standard protocol of modern medicine. Condition worsened day by day. The so treated with Ayurveda medicines here. Patient was actually advised for the amputation, but he considered for Ayurveda treatment on his will. Next slide. Next slide. So this is the condition of the patient before treatment. You can see in the right corner that the patient's here actually the amputation was advised to the patient, and after 6 months, during the 6 months of the course, patient the condition was worsened day by day. After that, we have started the treatment, and within I can say that within 1 month and 34th 1 month or patients have very good recovery. So we can see that the recovery now the patient is right now under the treatment for next, but marginally I can say that 90% recovery was happened in this case. Previous slide. For the first month of the treatment, the Dvigun Makar Doj, Mukta Pishti, Swarnamalini, Prava Panchamrut, Rasna Amalki, Pipli Timodu, Sariva, Jatamansi, Potol, and Ayurveda was used. For the second month of treatment, Rope Sundar, Swarnamakshi, Shanka Basma, Kukilaksha, Manjishta, Shatavari, etc. were used. And common was Sarivadhyasa was given for the continuous treatment as a continuous treatment, 20 ml TDS dose. External for the external application, here the decoction was used of this medicine. That is Arjun Manjishta Nimbapatra Swaras for Dhavan of wound and wound cleaning. Because I have seen that during this total course of diabetic complications, that all these medicines for external applications having great results, because it not only cleans the or it not only having antimicrobial action but also having the peripheral blood circulation. It increases the peripheral blood circulation. So by that condition, we get the result of the wound healing action. And why here again Makar Goj was used or Mukta Pishti was used? I have consideration regarding the Mukta Pishti, that Mukta is a embryo of that in that shell who having who having a capacity of new generation or regeneration. That's why I think that the Mukta having great results in the regeneration and having a great capacity of regeneration. For in each and every degenerative disorder, I use Mukta Pishti. That is the reason behind that. And again, the gold preparations having great result, great regeneration capacity. So here, Makar Doj was the basic product, and again, Mukta Pishti, Swarna Malini was also added. In this patient, again, there was a condition of uncontrolled diabetes. And for, according to our Siddhanta, Swatantra Paratantra condition, we need to treat Swatantra also and Paratantra also. So basically, idea behind the diabetic complication that first we need to control the diabetes by any means. And I have seen that all these medicines which I have write on the slides having capacity to control the uncontrolled diabetic conditions. We can get this sugar controlled very nicely. Again with the symptoms also. So after controlling the sugar, then we get the results in these complications. So at the same time, we need to control diabetes also and the diabetic complications too. So all these medicines having that capacity. See, what is the Rasa medicines having actions like we can't think also what can do it. It is not only with the one disease or one disorder. It having the extraordinary diaspora for the all diseases. A single medicine can be used in the many type of disease and disorders, having the extraordinary results in every diseases. We need to think only for the Sahapana and Anupana. So when we are using Makar Dvaja, we need to choose the secondary medicine with it. Like which herbal can be useful in the diabetes, which herbal can be useful in the thyroid, which herbal can be used in the hypertension, etc. like this. Basically, the drug is same, but the other drugs with all these basic principal drugs, we have to change them. So here in this case, I have used Yastimodu Sariva. Again, Sariva is the best drug, I can say that for the vascular diseases or for the regeneration capacity. So next slide. So this is the actually improvement in the patient. Next slide. Diabetic ulcer. This is again the same case. Next slide. Before 11-month patient having diabetic ulcer but not recovered, so tried for Ayurveda treatment, and within 1 month duration patient was having very great recovery. This is the lab was given also, that is the Arjun Churna lab, and it is basically Arjuna, it's not N, because in the nowadays we have many other herbals are also there, but as per my consideration or as per my observation, Arjuna having very great results, but when considering his substitute N, N does not having this type of results. Next slide. Do you have a time or okay, 5 minutes? So we can wind up here. Basically, next slide. So what is the actually, you can go for last slide. You can go for last slide. These are the actually complications. We need extra time for this presentation because every case we need to discuss thoroughly. All these complications are a single disease. We can say that mucormycosis is a very vast disease or disorder, or like that. Another medicines are another disorders are also there, like non-alcoholic steatohepatitis or liver parenchymal disease or nephropathy, etc., etc. All these complications are very major in right now due to the diabetes. And after post-COVID conditions, all these conditions are also worse from the before conditions. So, what is the Rasa Aushadhi's role here? I can just, it is a previous slide, one slide previous. What can actually Rasa Aushadhis, what is the working of the Rasa Aushadhis? Or what? Next slide. रस औषधि किसके ऊपर डिपेंड करती है? रस औषधियों को काम कैसे हम यूज में ला सकते हैं? इसके लिए कुछ चीजें जरूरी है कि जो एक्चुअली कोई बताता नहीं जल्दी कि प्रॉब्लम रस औषधि में क्यों है, कि रस औषधि हम कैसे यूज कर सकते हैं. तो बेसिक थिंग है रस औषधि इज मैन्युफैक्चरिंग प्रोसेस. A single Swarna Bhasma having 83 different preparation methods. And these 83 different preparation methods having different actions, therapeutic actions. So we need to assess those preparation methods first. And after preparing them, we can use them as a medicine. Not a single Swarna Bhasma which is available to us having all that actions. That is the best important thing. Quality of raw materials is again there. We are right now the condition is very good because due to the social media and etc. or Google, we know that which is the best quality medicine. But till date we are using Vimala on the behalf of Swarna Makshika. So when we are applying Swarna Makshika, we don't know whether it was prepared by Vimala or prepared by Swarna Makshika. So best quality raw material is also, and there is very complications in the raw material identification of Rasa Shastra. Not only Rasa Shastra, it is also in the herbals also. Rasa Aushadhi manufacturing procedure, which I have mentioned right now, that single Swarna Bhasma having 83 different methods of preparation. Makkar Doje, there are 27 different methods of preparation. So these manufacturing procedures definitely having a different action. Just in the morning, Vikrant sir have told me regarding the Tamra Bhasma. Yes, Tamra Bhasma having different colors because it having different procedures of preparation. According to that preparation method, the results of the Rasa Aushadhi get changed. When we need to assess this extraordinary results in the field of Ayurveda or in the field of this science, we need to manufacture these Rasa Aushadhis properly. Quality of finished product, we have to assess the quality of finished product first. Dosage form of the medicines, it is very important. When we are using the tablet form, it having some limitations for the working. Many of the Rasa Aushadhis having the most encouraging result we can get by sublingual action. So in Churna forms of the Rasa Aushadhi having great results than tablet forms. Duration of medicine, this is again a very complicated condition. According to person, it varies. But the duration of the Rasa Aushadhi should be minimum. Prakriti and other examinations are very important in the Rasa Aushadhi applications. Many people think that the Rasa Aushadhi can treat any patient at any time, but it's not right thing. According to Prakriti corrections, we need to choose the right medicine. Like Tala Sindura, we have to assess the Prakruti Pariksha, whether it's having patient having Kapha Prakruti, we can use it. And Shila Sindura having different action, Malla Sindura having different action, Samir Pannaga having different action. All these kalpas are somal kalpas, but all having different indications. So we need to choose the indications of that accordingly. Some surprising reactions are also there due to the rasa Aushilis. We have to assess them properly. And Naga Vasma related medicines, we have to take care for preparation also and for the prescription also. And what's another related to Karpa? Again, I can say that you have to assess all these things before practicing rasa medicines. We need to think properly and then you can prescribe these medicines. So my humble submission here, next slide. Last slide. These are the procedures of the rasa Aushadhi preparations. This is the one slide is a Satopatana, another slide is the Jaram process. So it's not magic, my dear friends. It's just a science where we are lacking with our knowledge only. So I am very much thankful to ATA for inviting me as a speaker here. And the session is over for question and answer. If you have any questions, please ask. Thank you very much.
Thank you, sir. Thank you so much. It's really very valuable session and it's give us very nice information. And thanks for sharing your knowledge and experience here. For the next, I would like to request Dr. Amit Pawar, sir, to please felicitate our speaker. Thank you, sir. I request Dr. Sachin Chandaria, sir, to please felicitate our co-chair, Dr. Amit Pawar. Sorry. I request Dr. Shilpa Revle, ma'am, to please felicitate our co-chair, Dr. Amit Pawar. Thank you, sir. Thank you, ma'am.
I would like to request Dr. Shilpa Revle madam to felicitate our coordinator, Dr. Rita Mandle madam. And Dr. Pallavi Pardeshi madam. Thank you. Thank you very much to the speaker and our chairperson. Now, before heading towards the next last session, we will have a short 5 to 10 minute talk of Dr. Vikrant Patil sir. I would like to invite Dr. Vikrant Patil sir to give his talk. Would like to introduce Dr. Vikrant Patil sir. He has completed BMS from Bharati Vidyapeeth and MD in Dravya Gun Vignan from Bharati Vidyapeeth. He is the owner and CEO of the Ayurvedic THYROID Thyroid Clinic, Pune, India, and director of Ayurgenics Ayurveda Private Limited. It's a known fact that any Ayurvedic practitioner known more for any specific specialty need to be perfect in Kai Chikitsa. So still mainstream of practice, his mainstream of practice is thyroid, that is thyroid, hypertension, yoga, rheumatic disorder, obesity, infertility, and diabetes. So we have a dynamic personality here to give a talk for 5 to 10 minutes. Thank you, sir.
Slide. हा नाही, TATC म्हणून आहे फोल्डर. TATC म्हणून आहे. मुळात गेल्या 2012, 13, 14 सालापासून मराठी ओके सगळ्यांना? हिंदी, इंग्लिश? तुम्हाला काय सोपं पडेल? हा ठीक आहे, मध्ये मध्ये इंग्लिश आणि हिंदी येतच आपल्याकडे, त्यामुळे काही विषय नाहीये, कारण एवढी मराठी कोणाचीच चांगली नाही. गेल्या 2010-12 सालापासून 14 सालापासून वेगवेगळ्या आयुर्वेदाच्या कॉन्फरन्सेस करतोय आणि दरवेळेचा अनुभव हाच आहे की शेवटच्या वक्त्यांना जनरली फक्त खुर्च्यांनाच लेक्चर ऐकायला लागतं. तर त्यातल्या त्यात खुर्चीत बसलेले जे काही श्रोते आहेत त्यांनी हे 4 शब्द ऐकावेत आणि त्यांचं मत द्यावं अशी मी विनंती करतो. ऍक्च्युली विषयाची सुरुवात कुठून करायची हा एक वेगळा मुद्दा असताना संजय सरांनी आता जे छानपैकी प्रेझेंटेशन दिलं, सकाळी आमचं बोलणं त्याच्यावरतीच झालं होतं बऱ्यापैकी, नागभस्म आणि वचनावरतीच झालं होतं आणि त्यातल्या रिसर्चच्या गोष्टी ज्या आहेत त्या पुढे येणं गरजेचं आहे आणि ते आपल्याकडे होत नाहीये असं आपल्याकडे आलेल्या रिसोर्स पर्सननी सुद्धा सांगितलेलं आहे आज कार्यक्रमामध्ये, तर ते होणं गरजेचं आहे. थोडासा पार्श्वभूमी सांगतो. 2010 सालापर्यंत मी पण सगळ्या जनरल प्रॅक्टिशनर सारखं सगळ्या प्रकारच्या आजारांवरती आयुर्वेदिक ट्रीटमेंट करत होतो. म्हणजे माझ्या दवाखान्याच्या बाहेर सुद्धा केस गळण्यापासून, मूळव्याधापासून, मुतखड्यापर्यंत, त्वचा रोगांपासून, एड्स आणि कॅन्सरपर्यंत सगळे क्लेम दिलेले असायचे. व्हॉट हॅपन्स विथ अवर आयुर्वेदा पीपल दॅट वी यूज टू ट्रीट एव्हरीथिंग and then we become jack of all and master of none. And I have found this very clearly in my practice, because the day when I started to practice in a specialized area, I found that there are many things which are not discovered, which are not known to us, and they should be studied thoroughly. आणि ज्या वेळेला तुम्ही ह्या पद्धतीने स्पेशलायझेशन मध्ये उतरता त्यावेळेला तुम्हाला, ज्याला आपण म्हणतो ना पाकळ्या उलगडत जातात एखाद्या फुलाच्या, अशा पद्धतीने तुम्हाला चिकित्सेचे पदर उलगडत जातात. कोणत्या आजाराची चिकित्सा कशी करायची हे त्याच्यातून कळत जातं. हा नेक्स्ट स्लाइड किंवा तुम्ही जर लोगो बघितला तर तो T.H.Y. असा आहे. तो थायरॉइड असा एक शब्द नाहीये. याचं कारण असं की ज्यावेळेला आपण थायरॉइडची ट्रीटमेंट सुरू करतो त्यावेळेला असं लक्षात येतं की थायरॉइडचे पेशंट हे डायबिटीसला प्रोन असतात. थायरॉइडच्या पेशंटला ऑस्टिओआर्थरायटिस बरसत असतो. थायरॉइडचा पेशंट हा ओबेज होत असतो. इन्फर्टिलिटीचा इश्यू त्यांना येत असतो. सो ऑल दीज डिसीजेस आर ऍक्च्युली इंटर रिलेटेड टू इच अदर. ज्याला आपण व्याधी उपद्रव म्हणतो त्या पद्धतीनं एक गोष्ट झाल्यानंतर दुसऱ्या गोष्टी त्या पेशंट्स मध्ये होत असतात. सो द पर्सन who is suffering from thyroid is actually 3 times more prone to diabetes. Thyroid patient is always obese. Thyroid patient suffers from infertility. So when you are treating thyroid, you are actually treating many things at a time. आता नेक्स्ट स्लाइड. आजच्या ह्या प्रेझेंटेशन मध्ये आपण जे पाहणार आहोत त्याच्यामध्ये थायरॉइडची प्रॅक्टिस का करायची ह्याच्याविषयी मी थोडंसं सांगणार आहे. 2015ला भारतामध्ये एक सर्वे झाला आणि त्या सर्वेनुसार देअर वर 42 मिलियन थायरॉइड पेशंट्स इन इंडिया. आणि हा 2015चा आहे. आज आपण 2022 निम्मा ओलांडून गेलोय. म्हणजे आता तो आकडा 50 लाखाच्या पुढे आरामात गेलेला असणार आहे. ठीक. त्याच्यापैकी साधारणपणे 9 मिलियन हे हायपर थायरॉइडचे पेशंट्स आहेत. वर्ल्ड वाईड बघायला गेलं तर 1.2% पीपल आर सफरिंग. वुमन आर मोर प्रोन्स, इट इज ऑलमोस्ट 11.4. सगळ्या पद्धतीनं म्हणजे हे सगळे आकडेवारी तुमच्या समोर ठेवलेली आहे. एवढ्या मोठ्या प्रमाणावरती थायरॉइड सगळीकडेच पसरायला लागलाय. भारताला डायबिटीसची राजधानी म्हणतात. मी तुम्हाला दुर्दैवानं मला हे सांगावं लागतंय की पुढच्या काही वर्षानंतर भारत हा थायरॉइड डिसऑर्डर राजधानी झालेली असेल आणि त्यावेळेला आपलं काम हे खूप मोठं असतं. नेक्स्ट स्लाइड. त्याची ही काही कारण आहेत. व्हिटॅमिन D3 डेफिशियन्सीज, स्ट्रेस, टेन्शन, एन्झायटीज, आपण जे खातोय त्याच्यावरती असलेले पेस्टिसाइड्स आणि बाकी साऱ्या गोष्टी. वन ऑफ देम इज लिकी गट. नेक्स्ट. आपल्याला स्लाइड्स थोडं पळवावे लागतील म्हणजे आधीच राहुल सरांनी कमी वेळ दिलाय, त्यात पण परत काटछाट केली आहे वरती येताना. Flaws of conventional treatment. Now come to the point. There are two types of thyroid when we see the blood values. पहिला आहे तो हायपोथायरॉइड, सेकंड आहे तो हायपरथायरॉइड. हायपरथायरॉइडचं प्रमाण कंपॅरेटिव्हली कमी आहे, हायपोचं प्रमाण जास्त आहे. ऑलमोस्ट 80% पेशंट्स आपल्याला जे पाहायला मिळतात ते हायपोचे पाहायला मिळतात आणि 20% जे आहेत ते हायपरचे पाहायला मिळतात. हायपरच्या बाबतीमध्ये जर आपण बघितलं तर लाईफ टाईम मेडिसिन्स घ्यायला लागतात. देर आर 3 टाइप्स ऑफ मेडिसिन्स. एक अँटी हॉर्मोनल ट्रीटमेंट, ज्याच्यामध्ये एक गोळी असते, ती दिवसातून एकदा, दोनदा किंवा तीनदा घ्यायची असते. कार्बिमेझॉल असं त्याचं नाव आहे. जगाच्या पाठीवरती कुठेही गेलं तरी कार्बिमेझॉल शिवाय दुसरं औषध थायरॉइडसाठी, हायपर थायरॉइडसाठी नाही. ॲलोपॅथीमध्ये हायपरथायरॉइडसाठी कार्बिमेझॉल व्यतिरिक्त दुसरं कुठलंही औषध नाही आणि हे औषध आयुष्यभर घ्यावं लागतं. सेकंड लाईन ऑफ ट्रीटमेंट रेडिओ ऍक्टिव्ह आयोडीन, म्हणजे मी कायम सांगताना सांगतो की छोटासा अणुस्फोट तुमच्या घशामध्ये करायचा आणि तुमच्या घशातली जी थायरॉइडची ग्लँड आहे ती जाळून टाकायची. तुमच्या गळ्याचा हिरोशिमा आणि नागासाकी करायचा. हे झालं की तिथं परत काहीच उगवत नाही, तिथं काही पिकत नाही आणि म्हणून थायरॉइडचे हॉर्मोन तयार होत नाही आणि देन द पर्सन बिकम्स हायपोथायरॉइड पेशंट परमनंटली. थर्ड जी ट्रीटमेंट आहे ती थायरॉइडेक्टॉमी आहे, ज्याच्यामध्ये तुला काही उपयोग नाही. अपेंडिक्स आहे टाक काढून, टॉन्सिल्स आहे टाक काढून, तसं आता थायरॉइड पण तुझं वाढले टाक काढून, ह्या न्यायानं थायरॉइड पण काढून टाकला जातो. ह्या तिन्हीमध्ये पहिल्यांदा मेडिसिनचे साईड इफेक्ट्स आहेत आणि त्यानंतर परमनंटली नंतरचे दोन जे आहेत त्याच्यामध्ये परमनंटली तुम्ही हायपोथायरॉइड मध्ये लँड होत असतात. नेक्स्ट. हा परत रिपीट होईल म्हणून मी घेत नाही. नेक्स्ट. त्याच्यानंतर जो आहे तो हायपोचं प्रमाण खूप जास्त आहे. म्हणजे तुमच्याकडे 100 पेशंट जर आले थायरॉइडचे तर त्यातले 80% पेशंट हे हायपोचे असणार, लक्षात ठेवा. पुन्हा मुद्दा तोच आहे, त्याच्यासाठी जे औषध आहे दॅट इज लिव्होथायरॉक्सिन किंवा थायरॉक्सिन सोडियम, विच इज अगेन द ओनली ड्रग हायपोथायरॉइड मध्ये वापरलं जाणार. तेवढं एक ओनली ड्रग आहे. एक फक्त अमेरिकेत बघायला मिळतं, आर्मर थायरॉइड नावानं औषध मिळतं, जे डुकराच्या थायरॉइड ग्लँड पासून काढलेला हॉर्मोन असतो. शास्त्रज्ञांचं असं म्हणणं आहे की माणूस आणि डुक्कर हे बऱ्यापैकी एकमेकांशी सिमिलर आहेत, असं म्हणून त्यांनी ते दिलेलं आहे. तर लाईफ टाईम मेडिकेशन घ्यायला लागतं. हे हॉर्मोन जो बाहेरून दिला जातो तुम्हाला दॅट इज आर्टिफिशियल हॉर्मोन, नेहमी लक्षात ठेवा. मी एक उदाहरण कायम देतो. एखादं जन्माला आलेलं बाळ त्याच्या आईच्या अंगावरती दूध येत नाहीये म्हणून त्याला पावडरचं दूध दिलं तर त्याचं पोट भरणार आहे, लक्षात घ्या. बट त्याच्यामुळं त्याला त्या सगळ्या गोष्टी मिळणार नाहीये ज्या त्याला आईच्या दुधातून मिळणार आहे. सो हिअर हॅपन्स सेम when your body uses your own hormone that gives you more results, whereas when you take the artificially prepared hormone, synthetically prepared hormone, तो तुम्हाला सगळे रिझल्ट देत नाही. तुमच्या कागदावरच्या व्हॅल्यूज नॉर्मल राहतात आणि बाकी पेशंट खूप त्रास त्याला होत असतो. नेक्स्ट. थोडस जाऊन टेक्निकल गोष्ट सांगतो. हायपरथायरॉइड म्हणजे थायरॉइडच्या ग्लँडमधून T3 आणि T4 हे हॉर्मोन जास्त सिक्रेट होतात. मी अशा खूप केसेस बघितले की TSH वाढलाय म्हणून त्याला हायपरथायरॉइड म्हणणारे डॉक्टर्स मी बघितलेले. सो कम टू द कन्क्लुजन, नाही मी बघितले, खूप बघितले. मी आता फेसबुकवरच्या अशा पोस्ट काढून दाखवू शकतो तुम्हाला, मला टाकलेले. सो थायरॉइडचा जो इश्यू आहे तो गंमत अशी आहे की ही ग्लँड आहे, त्याच्यातून निघणारे दोनच हॉर्मोन आहेत, एक T3 आणि दुसरा T4. सो T3 आणि T4 वाढतात म्हणून त्याला हायपर म्हणायचे, T3 आणि T4 कमी होतात म्हणून त्याला हायपो म्हणायचे. आणि ह्यांना कॉम्पेन्सेट करण्याचं काम, ह्यांना कंट्रोल करण्याचं काम TSH करत असतो. तो त्यांच्या बरोबर उलट्या पद्धतीने रिॲक्ट होतो. म्हणजे T3 T4 वाढले तर TSH कमी होत असतो. औषध अजून सुरुवात पण नाही केली. T3 T4 चेंज होत असतात, हे ह्याच पद्धतीने उलट होत असतं. नेक्स्ट. म्हणजे ज्याला इथं T3 T4 जास्त ऍक्ट व्हायला लागतो त्याला तिकडून TSH जास्त ओव्हर रिॲक्ट व्हायला लागतो. ह्याला म्हणायचं हायपोथायरॉइडिझम किंवा हायपोथायरॉइडिझम. हे हायपोचे आणि हायपोचे वेगवेगळे सिम्पटम्स आहेत. नेक्स्ट. 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 इथं आपण त्या पॉइंटला येतो. थायरॉइडचा पेशंट ज्याला थायरॉइडसाठीची आत्ताची कन्व्हेन्शनल लाईन ऑफ ट्रीटमेंट यूज करत असतो, मेडिसिन्स वापरत असतो, त्यावेळेला दिस पिक्चर इज लाईक आईसबर्ग. वरती नॉर्मल रिपोर्ट दिसत असतात आणि कॉन्स्टंट मेडिकेशन दिसत असतं. पाण्याच्या खाली जसा खूप मोठा हिमखंड असतो तसा पेशंटचे गॅस्ट्रिक प्रॉब्लेम चालू असतात, मेन्स्ट्रुअल डिस्टर्बन्सेस चालू असतात, फर्टिलिटी इश्यूज चालू असतात, वेट फ्लक्च्युएशन चालू असतं, सायकोलॉजिकल सफरिंग असतं, बाकीच्या सगळ्या कंप्लेंट्स म्हणजे वजन वाढणं, केस गळणं, त्वचा कोरडी होणं, शुगर वाढणं, त्याच्यानंतर कोलेस्ट्रॉल वाढणं, त्वचा कोरडी पडणं, नेल ब्रिटल्स होणं, हेअर लॉस होणं, ह्या सगळ्या कंप्लेंट्स चालू असतात. फक्त पेशंटचा रिपोर्ट नॉर्मल असतो आणि तेवढ्या एका गोष्टीवरती पेशंटला खुश ठेवलं जातं. नेक्स्ट. आणि म्हणूनच गेल्या 2 वर्षापूर्वी आपण एक नवीन कन्सेप्ट मांडला की जसं आधी पीसीओडी होतं आणि त्या पीसीओडीला आता पीसीओएस केलं गेलं, पॉलिसिस्टिक ओव्हेरियन डिसीजला पॉलिसिस्टिक ओव्हेरियन सिंड्रोम मानलं गेलं. तसा कुड थायरॉइड डिसऑर्डर्स बी बेटर अंडरस्टूड अँड डेल्ट ॲज थायरॉइड सिंड्रोम. म्हणजे थायरॉइड ह्या गोष्टीला तुम्ही डिसऑर्डर किंवा डिसीज म्हणून न बघता त्याला जर तुम्ही सिंड्रोम म्हणून बघायला केली तर तुम्ही त्या पेशंटला जास्त चांगला न्याय देऊ शकता. हा विचार एमबीबीएसच्या एंडोक्रायनॉलॉजीच्या विषयांच्या सब्जेक्टमध्ये एका बीएमएस माणसानं आयुर्वेदाच्या माणसानं मांडलाय आणि मला खात्री आहे की पुढच्या 4-5 वर्षामध्ये तो अप्रूव्ह होईल. पेपर सिलेक्ट झालेला आहे पण हा ऍप्लिकेशन मध्ये यायला सुरुवात होईल ह्याची मला खात्री वाटते. नेक्स्ट. नाव कम टू टीएटीसी. टीएटीसी म्हणजे द आयुर्वेदिक थायरॉइड क्लिनिक जे आम्ही गेल्या 2010 सालापासून रन करायला सुरुवात केली आहे. त्याच्यामध्ये बाहेर स्टॉल आहे, तुम्ही बघू शकता. तिथे औषधांना एका स्पेसिफिक पद्धतीनं आपण डेव्हलप केलेलं आहे. सगळ्या पेशंट्सना वापरल्या जाणाऱ्या मेडिसिन्सचा एक प्रोटोकॉल तयार केला आहे. मला कल्पना आहे पुरुषम हा प्रकृतीनुसार औषधं बदलतात पण तरी सुद्धा आरोग्यवर्धिनी ही जशी कुष्ठामधलं एक औषध आहे म्हणजे कुठल्याही कुष्ठामध्ये तुम्ही रॅन्डमली साधारणपणे वापरू शकता अशी कंडिशन असू शकते किंवा गंधक रसायन वापरू शकतो. तशाच पद्धतीनं तुम्हाला एका ठराविक लाईनसाठी एका ठराविक डिसीज लाईनसाठी तुम्हाला एक ठराविक ट्रीटमेंट लाईन पण आखावी लागते आणि गेल्या 2010 पासूनच्या आतापर्यंत याच्यामध्ये आपण हे लाईन ऑफ ट्रीटमेंट तयार करून घेतली आहे. सो व्हॉट इज कन्व्हेन्शनल ट्रीटमेंट? नॉर्मल रिपोर्ट स्टिल ऑल कंप्लेंट्स शिल्लक असतात, लाईफ टाईम मेडिकेशन घ्यायला लागतं. वेन यू कम टू टीएटीसी नॉर्मल रिपोर्ट्स विथ नो कंप्लेंट्स, लिमिटेड ट्रीटमेंट. लोकांना असं वाटतं की आयुर्वेदिक ट्रीटमेंट सकाळी विषय निघाला होता की आयुर्वेदिक ट्रीटमेंट महाग असते पण गंमत बघा 2 वर्षासाठी आयुर्वेदिक ट्रीटमेंट घ्यायची असेल आणि लाईफ टाईमसाठी ॲलोपॅथी ट्रीटमेंट घ्यायची असेल तर आयुर्वेदिक ट्रीटमेंट ही स्वस्त पडते. आणि लास्ट इज सिस्टमिक इम्प्रुव्हमेंट. मी हे पुढे पण थोडं अजून डिस्क्राईब करेन, पुढे जाऊ. नेक्स्ट. आयुर्वेदामध्ये थायरॉइड सांगितलाय का असं सगळे मला विचारतात. मी सांगतो की आयुर्वेदामध्ये थायरॉइड सांगितलेला नाहीये. जो आहे तो तुम्हाला कोरिलेट करायला लागतो तुमच्या सिम्पटम्सनुसार आणि दोष धातू समूच्चनुसार. त्याच्यामध्ये रसवसोतस, अग्नी, सिस्टमिक कन्सिडरेशन, लिव्हर फंक्शनिंग आणि गलगंड ह्या सगळ्या गोष्टी आपल्याला बघता येतात. ह्या सगळ्यांना मिळून आपल्याला थायरॉइड म्हणून एकत्र बघावं लागतं. नेक्स्ट. आयुर्वेदिक थायरॉइड क्लिनिकमध्ये आतापर्यंत 15,000हून जास्त पेशंट झालेले आहेत. त्याच्यामधले जवळपास 70% पेशंट्स हे हायपोचे आहेत आणि 30% हायपरचे आहेत. नेक्स्ट. हे काही फोटो आहेत प्री आणि पोस्टचे. गलगंडाचा साईज कमी झालेला. नेक्स्ट. नेक्स्ट. हे काही रिपोर्ट्स आहेत. आता हे रिपोर्ट्सचा फोटो काढताना तो ह्याच्यापेक्षा जास्त हे करता येत नव्हता म्हणून मला तो सांगता आला नाहीये. 2015ची केस आहे. 5 वर्षापूर्वीपासून डिओमार्काझोल 20 mg दिवसातून 2 वेळा म्हणजे दिवसाचा 40 mg चा डोस होता. ह्या कंडिशन मध्ये पेशंटला फक्त आणि फक्त ग्रंथी काढून टाकायला सांगितले जाते किंवा RAI सांगितला जातो आणि हा पेशंट त्याच्यानंतर पूर्णपणे नॉर्मल आहे. कुठलंही आयुर्वेदाच्या औषध सुद्धा न देता ॲलोपॅथीचं औषध पूर्ण बंद झालंय, त्यानंतर आयुर्वेदाचं औषध पूर्ण झालंय आणि पेशंट आजही नॉर्मल आहे. पहिली पेशंट माझी हायपरथायरॉइडची 2014ची रशियामधून गलिना नावाची मुलगी आली होती. बफ्थॅल्मसला आपण म्हणतो, डोळे बाहेर आलेले होते. तिला आजही हायपर थायरॉइड नाही. 2 डिलिव्हरी झाल्या, दोन्ही मुलं नॉर्मल आहेत, त्यांना थायरॉइड नाहीये आणि तिला सुद्धा थायरॉइड नाहीये आणि डोळे आता परत नॉर्मल झालेले आहेत. नेक्स्ट. हायपोथायरॉइडची अजून एक केस. 75ची आधी गोळी चालू होती आणि नंतर कुठलीच गोळी चालू नसतानाची. नेक्स्ट. पुन्हा हायपोची 2014 पासून 75ची गोळी होती. इकडे जर आपण पाहिलं तर इथं तुम्हाला दिसतील अँटी मायक्रोझोमल अँटीबॉडीज ह्या 124 होत्या आणि इथं त्या 77 वरती आल्या. म्हणजे ऑटो इम्युनिटी जी आहे ती पण आयुर्वेदाच्या माध्यमातून आपल्याला ट्रीट करता येऊ शकते. नेक्स्ट. ऑटो इम्युन डिसऑर्डर हा आणखीन एक मोठा विषय होईल. पुन्हा विथ कार्बोमायझोल 15 mg ओडी विदाउट रिपोर्ट. आणि तुम्ही जर हे बघितलं ड्युरेशन बघितलं तर 10 जानेवारी आणि 20 मे असा फक्त 4 महिन्याचा 5 महिन्याचा स्पॅन त्याच्यामध्ये गेलेला आहे. नेक्स्ट. नेक्स्ट. मी ऑब्झर्वेशन सांगत बसत नाहीत कारण मी त्या बऱ्यापैकी आता बोललेलो आहे त्यामुळं. नेक्स्ट. पण ट्रीटमेंट जी आहे ती आयुर्वेदाची ट्रीटमेंट जास्त उपयोगाची पडते. नेक्स्ट. हा मगाचा होता तो हायपरचा कर्व होता, हा आताचा आहे तो हायपोचा आहे. नेक्स्ट. हे त्याचे कन्क्लुजन्स आहेत. साधारणपणे 1 ते 2 वर्षाचा नेक्स्ट 1 ते 2 वर्षाचा स्पॅन पेशंटला लागू शकतो. काही पेशंट 6 महिन्यामध्ये सुद्धा बरे होतात, काही पेशंट वर्ष किंवा 1.5 वर्ष किंवा 2 वर्ष सुद्धा घेऊ शकतात. ह्या केस डिटेल गेले तर ही हायपरची केस आहे. हायपरच्या केसेसमध्ये वजन कमी होणं हा प्रकार असतो, पण तरी सुद्धा काही पेशंट्स असतात 1-2% यांच्यामध्ये वजन वाढतं. ही त्यातली केस होती जी अवघड असते. जसं आपण वातशुक्रम हे ट्रीट करायला अवघड म्हणतो ना, तशी उलटी लक्षणं दाखवणारे पेशंट अवघड असतात. तुम्ही जर बघत गेलात तर 4-12चे पहिले सिम्पटम्स आहेत आणि 22-5चे दुसरे रिपोर्ट्स आहेत. मगाशी ज्या केसचं दाखवलं तुम्हाला तेच आहे तो. वजन 77 किलोवरून 65 किलोवरती आलंय. हेवी जास्त होतं ते. हेअरफॉल थांबलाय, होल बॉडी स्वेलिंग थांबलीये, गॅस्ट्रिक डिस्टर्बन्सेस नाहीयेत, मसल क्रॅम्प्स नाहीयेत, पल्पिटेशन नाहीये, रिकरंट थ्रोट इन्फेक्शन नाहीये. नेक्स्ट, त्याच पेशंटला जे सायकोलॉजिकल चेंजेस होते त्याच्यामध्ये क्राय, मूड स्विंग, डिप्रेशन, इरिटेशन, एन्झायटी आधी खूप होतं, आता नाहीये. ह्या सगळ्या टायर्डनेस, लिथर्जी, कोल्ड इंटॉलरन्स, स्किन ड्रायनेस आणि थ्रोट स्वेलिंग सगळं गेलेलं आहे. नेक्स्ट, नेक्स्ट, हे त्याच पेशंटचे रिपोर्ट्सचे डिटेल्स आहेत. नेक्स्ट, 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 नेक्स्ट. 1 ते 2 वर्षाचा स्पॅन आणि थायरॉइड पूर्णपणे बरा होऊ शकतो. नेक्स्ट, नेक्स्ट. 70% हायपोचे पेशंट पूर्ण बरे होतात, 17% जे आहे ते मॉडरेटली इम्प्रूव्ह होतात, 7% माइल्ड इम्प्रूव्ह होतात आणि सिग्निफिकंट इम्प्रूव्हमेंट न दिसणारे पेशंट हे 6% असू शकतात हायपोमध्ये. नेक्स्ट, हायपरथायरॉइड मध्ये आलं तर 93% केसेस पूर्ण बरे होतात, 3% जे आहेत ते मॉडरेटली इम्प्रूव्ह होतात, माइल्ड इम्प्रूव्हमेंट 2 मध्ये दिसते आणि 2% पेशंट अजिबात बरे होत नाही, ज्यांच्यामध्ये इम्प्रूव्हमेंट होत नाही. नेक्स्ट, लास्ट पॉईंट फक्त मी घेतोय, लक्षात घ्या. टीएटीसी ही एक क्लिनिक आहे आणि आपल्याला अख्ख्या भारतामध्ये 50 लाखाहून जास्त पेशंट्स आहेत आणि हे आपल्याला बरे करायचे. ह्या पेशंटचा एवढा मोठा डेटा असताना त्यांना आज कुठल्याही पद्धतीनं ज्या पद्धतीची ट्रीटमेंट त्यांना पाहिजे आहे, ज्याची गरज आहे ती त्यांना मिळत नाहीये आणि ती द्यायची असेल तर आपण कंबर कसली पाहिजे. कन्व्हेन्शनल ट्रीटमेंटला फेल्युअर आहे की ते पेशंटला नॉर्मल करू शकत नाही. टीएटीसीकडे बेस्ट सोल्युशन पेशंटसाठीच आहे. फ्रँचायझी मॉडेल प्रूव्हन झालेलं आहे. रिटर्न ऑन इन्व्हेस्टमेंट 3 वर्षामध्ये माघारी मिळतात. तुम्ही जेवढी क्लिनिकला इन्व्हेस्टमेंट करताय, जेवढा खर्च करताय, तो 3 वर्षामध्ये माघारी मिळतो पूर्णपणे. नेक्स्ट, युनिक ट्रीटमेंट आहे ज्याच्यामध्ये आपण R&D केलेलं आहे सगळं आणि त्याच्यात शिवाय दुसरं इथं कुणीही कॉम्पिटिटर नाही आहे. प्रॉडक्ट जे आहेत त्यांचं पेटंट घेतलेलं आहे. लाईन ऑफ ट्रीटमेंट जे आहे त्याचा कॉपीराईट घेतलेला आहे, तो फायनलाइज झालेला आहे. मेडिसिन्स FDA अप्रूव्ड आहे. नेक्स्ट, ह्या लास्टच्या स्लाइडने मी कन्क्लूड करतोय. कॉपीराइटेड ट्रीटमेंट आहे, युनिकली डेव्हलप्ड सॉफ्टवेअर फॉर केस टेकिंग, ट्रीटमेंट अँड डॉक्युमेंटेशन. मी आता तुमच्या समोर अगदी पॉईंट टू पॉईंट सगळे रिपोर्ट्स आणि सगळ्या गोष्टी सांगू शकलो. त्याचं कारण सॉफ्टवेअर ज्या पद्धतीने डेव्हलप केलेलं आहे. तुम्हाला इथं जे डॉक्टर टीएटीसी मध्ये काम करतात किंवा टीएटीसीची फ्रँचायझी ज्यांनी घेतली आहे त्यांना सगळ्यांना हा डेटा मेंटेन करणं अजिबात अवघड होत नाही. मोबाईल ॲप पेशंटच्या कन्व्हिनियन्ससाठी तयार केलेला आहे. शेवटचे 2 मुद्दे ते सगळ्यात महत्वाचे आहेत. मिशन थायरॉइड हे आम्ही टीएटीसीच्या माध्यमातून लॉन्च केलेलं आहे. भारतामध्ये एकही थायरॉइडचा पेशंट ठेवायचा नाही, सगळे पेशंट बरे झाले पाहिजे हे टार्गेट आपण ठेवलेलं आहे. त्यामुळे मिशन थायरॉइड फ्री इंडियासाठी राबवायचं आपल्याला. सगळ्यात महत्वाचा, सगळ्या डॉक्टरांसाठी असणारा सगळ्यात शेवटचा मुद्दा असा की पेशंटला बरं केल्यानंतर जो समाधान जे समाधान त्या डॉक्टरना मिळत असतं, हे समाधान पेशंटला मॅनेज करण्यामध्ये मिळत नसतं. टीएटीसी मध्ये आपण पेशंट नॉर्मल करतो, बरा करतो, त्याला त्या आजारातून मुक्त करतो. त्यामुळं आपल्याला ह्या टीएटीसीला तुम्ही जॉईन व्हा. बाहेर स्टॉल आहे, त्याच्यामध्ये तुम्हाला आणखी काही माहिती हवी असेल तर ती तुम्हाला मिळेल. नेक्स्ट स्लाइड. थँक्यू. झोप बहुतेक उडाली असेल.
Thank you very much, Dr. Vikrant Patil, sir, for your elaborative presentation on thyroid, and we will surely associate with TATC in future. As a Shalaki, I will assure you that we will surely associate with TATC in future. Now, I would like to request Dr. Pradeep Jodhare, sir, our executive member, Teachers Association, to kindly felicitate Dr. Vikrant Patil, sir. Thank you, sir. Now we are heading towards the last and fifth scientific session. The topic of this session is evidence-based preventive cardiology practices in Madhava. And to coordinate this session, I would like to call upon our session coordinator, Dr. Ritesh Damle, MD, PhD scholar, assistant professor in the Department of Kai Chikitsa at Sumadhi Vaishya Ayurved Mahavidyalaya, Hadapsar, Pune, and Dr. Manisha Thapre, MD, PhD scholar, working as an assistant professor in the Department of Swastrut and Yoga at DY Patil College of Ayurveda and Research Center, Pimpri, Pune. So without wasting any time, I would like to call upon the session coordinator to take in charge of the session.
Good afternoon, Manano. I, Dr. Manisha Thakre, and my colleague, Dr. Ritesh Damle, feel honored to welcome all delegates on behalf of Ayurveda Teachers Association for the session Evidence-Based Preventive Cardiology. As we all know, from the ancient time, Ayurveda is known for serving the society by Swasthasya Swastha Rakshanam. And this concept is exactly applicable on preventive cardiology. So, over to you, sir.
Chairperson for this last session is Professor and Dr. Kadlaskar Bharat. Today's co-chair for this session is Dr. D.G. Dipankar sir. He is MD Ayurveda from Banaras Hindu University at in Kai Chikitsa. He is founder and director of Snehadeep Ayurveda and Panchakarma Center. He is recognized PhD guide and in Kai Chikitsa at DY Patil Vidyapit, Pune. He received Mahakamal Ayush Award from the Department of Ayush, Government of India in 2018 for the contribution in the field of Ayurveda. I request Dr. Dipankar sir to please be on stage. Today's speaker, Dr. Gurudatta Amin sir. I request him to be on stage. I request Dr. Dipankar sir to give a brief introduction about speaker. Thank you.
It is an honor to request Dr. Gurudatta Anandami. He is a chief medical officer at Madhav Hospital, and his educational qualification is his deep post graduation in Sanhita Siddhant, and his career summary. Actually, he is a chief medical officer of the organization Madhava, and managing highly experienced core medical team. He is having work experience of many years with Madhav Hospital. He delivered various lectures at Vidhan Bhavan, Maharashtra regarding awareness lecture on preventive cardiology at also World Ayurveda Congress in 2019. He published 63 research paper in national and international journals. So I would like to invite him for the lecture.
Okay, fine. So myself, Dr. Gurudatta Ami, Chief Medical Officer, as I introduced. The core philosophy of Madhava. I am here to present evidence-based preventive cardiology practices at Madhava. And what is our core philosophy? Core philosophy is this: all lifestyle diseases are reversible if sincere and targeted efforts are deployed in modifying habits of the patient. So this is a core philosophy, and with this core philosophy, we are working on diabetes, heart disease, blood pressure, cholesterol, hypothyroid, everything. And we are getting outstanding results. So today I'm going to present something about diabetes, something about blood pressure, and something about heart disease. So these three diseases I will try to cover. They have given me 40 minutes, and that is sufficient for me. I will enjoy the freedom. No, very few doctors are there in front of me, but I'm happy. At least these doctors are there, and believe me, I will give my best so that you will learn something good today from this session. So let me start with the first, diabetes. So just go through this example. Mohan and Vijay, both of them are good friends. At the age of 40, both are diabetic, and they came to one function, and over there they have consumed food for gulab jamun, and now their sugar is 400. So both of them have 400 sugar now. Now what the Mohan has done? Mohan has realized that I'm a diabetic, my sugar has gone up. Now what I need to do? I need to take a medicine. So he has taken a tablet, and now after tablet, his blood sugar is 180. What the Vijay has done? Vijay has decided to go for a walk. He asked the Mohan, I will go out and come back within 45 minutes. And after coming back, 45 minutes, his sugar came down to 180. So in both these cases, there is one simple question that I need to ask, or I will say, I ask this question to myself. What has happened with the sugar that is 400 to 180? That means by 220, that sugar has gone down in the case of a Mohan as well as in a Vijay. What is the difference between these two conditions? In the first case of Mohan, the medicine has shifted that blood sugar from blood compartment, that means intravascular compartment, to somewhere, some else. It might be a liver, it might be a muscle, it might be adipose tissue, don't know. In case of Vijay, that sugar got burned. That means that glucose was converted into energy, carbon dioxide, and water. So in this scenario, what I realize is this. These are the allopathic oral hypoglycemic agents, okay? What they are doing, just see to it. Out of these oral hypoglycemic agents, it might be a sulfonylureas, it might be a metformin, it might be a carbose, GLP-1 agonists, SGLT2 inhibitors, glitazones. Just see to it what exactly they are doing. I'm trying to teach you whole pharmacology of oral hypoglycemic agents through this slide. What the metformin is going to do? Metformin is going to ask your liver not to produce a sugar. So metformin is responsible for the inhibition of hepatic glucose production. So what it is going to do? It is going to inhibit the sugar production in liver. Is it the way how you should deal with the type 2 diabetes? I will say no. Because type 2 diabetes is a problem of insulin resistance. It is not a problem of hepatic glucose production. But still, metformin is going to work over there and trying to control the blood sugar. Let's talk about sulfonylureas. They are going to ask your pancreas to produce more and more insulin so that the sugar levels can be brought down. But if I will ask you a simple question, whether the type 2 diabetes is a problem of insulin production or it is a problem of insulin resistance, what would be the answer? Can anyone answer me? Is it a resistance problem or a production problem? It is a problem of a resistance. It is not a problem of a insulin production. If you will check out the serum insulin levels of your diabetic patient, you will realize that they have a high insulin level. Then what's the role of a sulfonylureas? Why we are giving sulfonylureas? At the end of the day, after giving sulfonylureas, what is going to happen? The pancreas later on will get exhausted and it won't function properly, and that patient will shift from Kapach prameya to the Vatach prameya. So this is a problem associated with the sulfonylureas when we talk about the glitazones, pioglitazones or rosiglitazones. These are the drugs which are going to convert the sugars into the lipids. Just see to it, you give oral hypoglycemic agents to the patient whose weight is 76, and after 1 year, his weight will be 76 lesser or higher. After giving OHA to the diabetic patient, what happens with the weight? Does it reduces or increases? It increases. You see to it, all these medicines are going to increase the body weight. The glitazones are going to shift that sugar in the form of a lipid and going to reduce down the blood sugar. Now, if something is converting sugar into fats and going to store it in your body, it is going to gain the weight, help you to gain the weight. The latest version, SGLT2 inhibitor, it is said to be the best drug. Why? Because it is giving a good income to the physicians, highly costly drug. But this drug is which is a non-physiological drug. Your kidneys are going to filter out the blood sugars till 180 mg per dl. Once it crosses 180 mg per dl, the kidneys will throw it out to urine. But this medicine is going to restructure this threshold. Instead of 180, if your sugar is 140, then also this medicine will take it out to the urine. So this medicine will actually make your urine sweeter. So this medicine itself is a non-physiological, which is accompanied by a number of different complications. The last drug, this acarbose, this is going to inhibit the sugar absorption from GI tract. So you eat a 4 gulab jam, you take the acarbose and see the blood sugar levels will be absolutely under control. Very good. But what is going to happen with that sugar which is there in your intestine? That sugar will be processed by your intestinal bacteria and the gases will be produced, ethane and methane, and patient will be having multiple symptoms associated with the gas disturbance. So, dear friends, what I want to tell you over here, that out of these medicines, no medicine is going to work on actual insulin resistance. So keep it in mind that these medicines are not actually the solution for the pathophysiology of type 2 diabetes. So with this thought in mind, Madhav Bagh has started journey. Until now, we have reversed thousands of patients, more than 22,000 patients we have reversed. And we have published the data in national international papers about what is happening with those patients. So all of you must be aware about the operations of Madhav Bagh. Why I'm saying that you people must be aware? Because in a month, we treat near about 60,000 patients. And I know that every one of you must have come across any one patient of Madhav Bagh who has taken a treatment from Madhav Bagh, and you must be aware about the operations. So these are the operations which are yielding these research papers. Now moving ahead, what is the definition of diabetes reversal? In a Charak Samhita Kafaja Prameha, they have said that the Kafaja Prameha are sadhya. So Kafaja Prameha are sadhya, that means the type 2 diabetes is reversible. What is the definition of reversibility? If you give a 75 grams of a sugar to the diabetic patient and you check their blood sugars, after 2 hours, if it falls below 140, then it can be labeled as a diabetes reversal. I hope everything is clear with you. And we have done this in thousands of patients. We have given them a 75 grams of a sugar, and after that, we have checked their blood sugar. After 2 hours, their blood sugars were absolutely normal. So that is called a complete diabetic reversal. Apart from that, we came up with the drug tapering protocol. So which drug has to be tapered first? Look, patient is coming to you with the complete faith, but generally what they observe, the Ayurvedic doctors are not confident about tapering of allopathic medicines. How many of you will agree with me? Will you be or not? You are agree with me, I'm happy with that. Why? Because we have a fear inside our mind that I don't know what this medicine exactly going to do with the body. And I should not stop it because this medicine is given by a renowned diabetologist. So I should not stop it. That is the pain in, or that is a subconscious thought which I have seen in the doctor's mind. So with that thought, to eliminate that thought, we have come up with a drug tapering protocol. Which medicine, if your patient is taking 7 medicines, which medicine you will taper and what is the justification for it and what is the benefit of it and how to educate a patient why you don't need this medicine. So all these things we have developed, and after that we have published these research papers. I'm not going to speak much about these research papers because these are just primary research paper, but this research paper is unique. Why? Because this was published, if you can see, Associations of Physicians of India. Have you heard this name? Associations of Physicians of India anytime? Have you heard, have you gone through that book, API? So who is going to write that book, API? It is a book which is written by Associations of Physicians of India. And in that research paper, in that journal, this paper was published, which was talking about post-reversal, 1 year, the condition of a diabetic patient. What happens with the diabetic patient after 1 year of a reversal? So this paper says that out of, if you say 100, 90% patients were able to manage their blood sugar levels absolutely at a normal level with routine home-based diet. So they were kept on home-based diet. And after a disease reversal, after 1 year also, the 90% patients were able to manage their blood sugar levels absolutely in a normal range. So what does it indicate? It indicates that a diabetes reversal is definitely possible. What we do for that, we give them a diet kit. This is a diet kit. I won't go into detail because otherwise it will elongate the session. We provide them everything, right from lunch, dinner, breakfast options, different breakfast options. And what is the core principle of it? It is a portion control. Matra Shitiya, Matra Shisya. So Ayurveda never spoken. In Ayurvedic literature, if you see to the Gunadharma of a Dravya, the basic thing about the diet is the title of that Adhyaya. The title of Adhyaya is a Matra Shitiya. Why he has spoken about the Matra? Because the quantity plays an important role. If you eat a moong itself, it is going to give you a weight gain. Only moong can increase your weight. You just continue eating a moong for 1 week or 2 weeks, you will find so many problems with it. So what it means that ultimately unless you control the quantity, things are not going to get sorted. So we provide them everything in a pack form, which gives us a fantastic results. We have done a fantastic research on Kokum powder, soup mix, everything is very well tested and which gives very good results. Then we do Panchakarma procedures, Snehan, Svedan and Basti. These are the routine procedures. After that, along with that, Snehan, Svedan, Basti, and you may ask me what we use. We use a Mesha Shungi, we use a Haridra, Amalaki, we use a Daru Haridra. These are the basic ingredients. We use a Guruchi in different forms, in quat form, in tablet form, in capsule form. And these are the medicines which we don't believe that they are there to control your blood sugar. They are there to correct your pathophysiology. We don't see to the Ayurvedic anti-diabetic medicines as a medicines to control the blood sugar, but they are there to control your disease pathophysiology or to reverse your disease pathophysiology. And with that understanding, we use it. SMBG, fourth secret I have mentioned over there. SMBG, self-monitoring of blood glucose. If you will ask me what is the key of success of Madhobag, hard follow-up, very hard follow-up. We follow our patient to that extent that they keep on sending us whatever food they eat every day. So our applications are full of the thali photos. They send us their thali photo every day, morning and night, dinner plate. And this thing improves the engagement with the system, and that gives us a fantastic results. Apart from SLBG, we have developed our application, which is really wonderful application. If you want to go through the review of this application, please go through the just reviews of this application. You will learn a lot from it. So diabetes reverse in this fashion. First, your blood sugar falls, then your weight reduces, then your medicines will be tapered down, then your HbA1c will be under control, and then 75 grams of glucose. So this is the overall summary of diabetic reversal. Now let me talk about hypertension. When we say hypertension and anti-hypertensive medicines, I studied a lot about modern medicine because I love it. It's really a great science. And this is a reason why after reading allopathy books, you get attracted to Ayurveda. At the end of the day, you realize that they have so many limitations. When I was reading a big book on hypertension, what I concluded from that book, they clearly say, I'm talking about the modern book of hypertension. They clearly say that the present treatment principles are far away from actual treatment principles of blood pressure. So what they are doing, they are just giving nitrodilators. So I'm going to talk about it. Just before we move ahead, understand the root cause of hypertension. Root cause of hypertension is this. You have a good blood vessels, but later on, it becomes somewhere atherosclerotic. And no one knows what amount of atherosclerosis is developed in your blood vessels. So no one knows. There is no any assessment method by which you can assess what level of atherosclerosis I have in my arteries. You may come across few investigations like flow mediated dilatation that is called FMD, but that is also not crystal clear. Why? Because no one knows what should be the thickness of your artery. I hope the point is clear. No one should know what should be the thickness of your own artery. So that is a point which is making a major change or causing a major problem. I'm just showing you a few results. These are the results. And now when we talk about the results, these results are not on home-based or clinic-based BP monitoring, because every one of you must be aware, there is a term called white coat hypertension. When a patient comes to you and when he sees you, when he enters your cabin, there is some sort of anxiety which is going to increase his blood pressure. So blood pressure goes up due to the anxiety, and that is going to cause white coat hypertension. To eliminate that factor, what you need to do, you need to ask the patient to go back to the home and check his blood pressure by his own with the electronic BP machines. So research has already proven that the BP taken by the doctor in his cabin is not right BP. They have evaluated it through the ambulatory blood pressure monitors, and this is the reason why at Madhavbag we apply ambulatory blood pressure monitors. With the help of those ambulatory blood pressure monitors, we come to know what is the BP in the morning hours, what is the BP at the afternoon hours, evening hours, at the night, at midnight, at 2 a.m. So based on that, we gathered a huge data, and based on that, these are the results. So 24-hour BP average has gone down from 147 to 137, 89 from 83. Now, while doing this, we have tapered down their all antihypertensive drugs. Now, I would like to show you something about antihypertensive drugs. These are some pathophysiological factors. I won't say much about it. Root cause of a problem is this: obesity. So, do you think that the obesity is related with the hypertension? Yes, very closely related to hypertension. Diabetes, yes, if you will see to the 100 diabetic patients, 50 will be having a diabetes, rest of the 50 will develop a blood pressure in next 5 years. So diabetes is a root cause of blood pressure. This is the reason why you need to understand that these structural vascular changes, just remember this word very well, structural vascular changes. These changes, until and unless you reverse these changes, blood pressure won't be able to, you won't be able to control the blood pressure. You can give ashwagandha, you can give a brahmi, you can give a jatamansi, and that can reduce down the stress levels, and that can cause a reduction in the blood pressure. But that is not the actual treatment of systemic hypertension. Why? Because systemic hypertension is something different. Let us go through this example. This will help you to understand what I was trying to tell you. Let's start. A normal, second column is a blood pressure patient. Third column is a patient on a medication. Let's start. Normal patient. Resting diameter 5 mm, BP 120/80. Now, when this normal person goes for a walk, goes for an exercise, what happens with his blood vessels? Do they dilate or they remain at the same diameter? They dilate or not? Yes or no? So they dilate. Now just understand, that is the capacity, that is the strength of your blood vessel to dilate as a response to exercise. So from 5 mm, the diameter will go to the 10 mm. So 5 mm is a reserve. 5 mm is a reserve. You are sitting over here in this hall and listening to me. So right now also you have a 5 mm of reserve. When you will start running, that reserve will be used and your vessels will be dilated. I hope the point is very clear with you. Let's talk about a blood pressure patient. Blood pressure patient is having a structural vascular changes. This is the reason why his arteries are now narrow. From 5 mm, it has gone down to 3 mm. And this is the reason why his blood pressure is 160/90. I hope the point is clear. His BP is 160/90. When he will go for a walk, his blood vessel will also dilate. A blood vessel of a hypertensive patient will also dilate because they have a 3 mm of reserve. Now, when the patient is on oral medication, the resting BP will be kept under control by these medicines by using that 3 mm of reserve. I hope the point is clear or not? No? So this patient is having a 5 mm of artery. This is a normal person from 5 mm to 10 mm. So 5 mm is a reserve. This case, 3 mm, 6 mm. 3 mm is reserve. I hope that is clear. In this case, how they have controlled the blood pressure, they haven't reversed the structural vascular changes. They have just used this reserve to keep a blood pressure in normal range. I hope the point is clear. Using reserve is not at all a good job. Using reserve is not job of a physician. The job of a physician is to build up the reserve so that that patient can be able to fight with the upcoming emergencies. I hope that point is very clear with you. So this is the reason why I keep on saying that the modern medicine is way away from really, they have they are really doing something blunder. You go through all the problems with the CCBs or the nitrodilators or the sympatholytics, everything, you will realize they have a great problem with it. So this is a complete structure how we treat hypertension patients. Let's talk about heart. How many of you have seen a patient with the blockages and their blockages have reduced down with Ayurveda therapy? Have you ever seen? Okay, so I'm going to present it to you. We do all these things for the heart disease patients. We use a Vincol. This is a combination of a Daditaka. This is a formulation which is based on the Daditaka Gruta. Please go through that Daditaka Gruta. We do all these things. We use this reverse diet kit in those patients. We perform ischemia reversal program or ischemia reversal treatment for these patients where we use Gokshur, Haridra, Amalaki. Along with that, we use Arjun and Punarnava, which gives us a fantastic results. Now I'm going to show you directly results. This is an analysis of 162 patients. What we have observed in 162 patients, the total atheroma volume reduced down by 29.44%. So blockages can be reduced. You can definitely say that 30% blockages can be reduced within 3 months. That is what we have observed in 162 patients. So in these patients, we have reduced down their weight, we have worked on their GI tract, we have worked on their effort tolerance capacity, we have stopped their allopathy medication. It might be a lipid lowering drugs, it might be a antiplatelet drugs, it might be a beta blockers, nitrodilators, and in spite of that, we have achieved these results. So these are the results which we have already shown it to you. Moving ahead, not only reduction in blockages, along with that, I hope few of you might be aware about this test. This is called as a myocardial perfusion scanning, where we give some agent. Generally, it was a thallium a few years back. When we inject it, it goes to the heart and it stays over there and it keeps on emitting the radiation. And those radiations will be captured. And based on that, there is a belief that the live myocardium will pick up more radioactive traces. So this is the reason why, based on this assessment, they are able to identify ischemia. All those regions which are not shining, they are called as ischemic regions. So what is the statistical analysis of treatment? Ischemia reduction on myocardial perfusion through SPECT and PI. Within 3 months, 30% ischemia burden was reduced. Let us compare it with the post-PTCA. After 12 months, they have found that 47.32%. Now over here, these patients were using all allopathy medicines I'm talking about. Post-plasty, all the nitrodilators were in use. Along with the plasty, nitrodilators were also in use. At Madhavbagh, we have stopped all nitrodilators. So all anti-anginal drugs we have stopped, and in spite of that, within 3 months, we got 30% reduction. And in post-plastic group, after 12 months, 47% ischemia reduction was observed. So this is also a big victory for us. Moving ahead to this paper, which we have published in European Society of Cardiology, then comes a heart failure reversal therapy. In a heart failure reversal therapy, we have published the data. You can see over here about ejection fraction. It has gone up from 39 to 45%. So after our therapy, the ejection fraction improves from 39 to 45. That was the achievement because we have studied the echo in detail. Let me tell you, echo is really a beautiful investigation. It gives you so many understanding about the internal pathophysiology. It is not just to be monitored as a ejection fraction pumping kitna hai, no. It speaks a lot about so many things which you need to monitor to improve that patient. And that we have at Madhavbagh, Khopoli and Kondali, we have that setup where we test, we keep on checking the echocardiographical reports of the patients. Then we came up with the randomized control trial, RCT. Have you heard this name, RCT, anytime? RCT is something, why I'm excited to speak about this RCT, because I know what pain it takes. Randomized control trial. Are you aware about randomized control trial? It is something where you need to tell a patient, heart patient, you are blinded. I am also blinded. I don't know which group you will fall. And if you fall in another group, just continue the treatment. If you fall in this group, then continue this treatment. And in this way, allopathic cardiologists, modern cardiologists, they were a principal investigator and they have completed this trial. So this is the reason why this trial is very important for me. Arm A was HFRT, Arm B was, and this paper was published in Indian Heart Journal. Let me talk about it. This paper was published in Indian Heart Journal. And after 3 months, what we have observed that the improvement in functional capacity of a heart failure patients was significantly higher than conventional oral medicines of allopathy. This was accepted by a cardiologist who was a principal investigator. This was really a tough task because we were not aware of what would happen. एक ग्रुप को हमने आयुर्वेद दिया है, दूसरे ग्रुप को conventional medicine दिया है. What will happen after 3 months? We were also not aware, but fortunately, Ayurveda won over here, and then we have published this paper in Indian Heart Journal. This is again a tough task to publish a paper in this journal, which is the Journal of an Indian Cardiologist. So this is what the achievement Madhav Bagh has till today. And about a survival rate, we have done one more trial to assess the 3-year survival rate, and we have observed that you can see over here the survival rate at Madhav Bagh or Madhav Bagh therapy, it is 85.27%. Why? Because these are the factors. Why? Because these factors. If any one of you want to become a good practitioner, I believe you should follow these pointers. Modern diagnostics. Make a use of all modern diagnostics. This will engage your patient in this will help your patient to keep his trust on you for longer duration. So use all modern diagnostics. Patient education. Spend time with your patient. Don't be in so hurry की मैं ओपीडी 10ची ओपीडी काढली 50ची ओपीडी काढली 100ची ओपीडी काढली काय ते पेशंट काय टाइमपास आले तुमच्याकडे त्यांना एज्युकेट करणं आपलं काम आहे. So educate them somehow, because until and unless you educate them, they won't be able to follow your instruction clearly. Third point, monitoring systems. You should have used modern gadgets to monitor your patients. Same what Madhav Bagh is doing. Importance of patient participation. Let them participate in their disease reversal journey. Let them. Participation is something where you should ask him, what should be your plan? What should be your dinacharya? How you will spend an average day at your home? So this is what the patient participation, motivation and fun. This is very essential. At Madhav Bagh, we celebrate a Vijayotsav. Yesterday only, we have felicitated. I hope if any one of you is aware about the Madhav Bagh and connected with the Madhav Bagh systems or any friend of you, just go through our web page or Facebook page. You will find so many patients, they were felicitated with the medals and the pagdi or feta, and they were really enjoying. What was that? All those patients who have worked hard to reverse their disease, and we have stopped their all allopathy medicines, and after that, we are felicitating them. So this is what is called as a motivation and fun. Medical audits, important task. When you do something good, it is not required that every time you will be good. Mistakes are every time they are going to happen. So you should have something to audit your own operations. Don't be in a mindset that मैं तो भगवान हूँ, मैं तो कभी गलती करूँगा ही नहीं. जो कुछ आप करते हो उस ऑपरेशन को ऑडिट करो. That audit systems helps you to improve your operations. Care of internal customers. Take care of your panchakarma therapists. Educate them well. Somewhere try to groom them, as a good human being. आयुर्वेद में भी कहा है उपचार नित्या द्राक्ष बहुत सारे गुणों के बारे में कहा है, तो उनका भी विचार ठीक से करें. Continuous education of team. You need to educate your own team also. Failure mode analysis based on product development. You should monitor your failures in different way. Don't run away from the failures. Generally, what happens whenever a doctor comes across a failure, he runs away from that failure. Don't do that. Just try to monitor, try to analyze what went wrong. And then you will be able to come up with a new product, new concept, new therapy. So that should be the operation and digitalization. Definitely that is the need of an hour. There are so many things. Digital engagement is on peak. And over there, you need to think of it and, live in the present era, which is an era of a digital world. So over here, I will stop. Thanks for patient listening. Madhav Bagh is having 270 clinics, 2 hospitals. We perform 30 stress tests per year. We do 1 lakh ECG per year, 3 lakh OPD per year, 2 lakh 44 Panchakarma procedures, and this is what we do. If you want to connect with us, our stall is there. Please go over there, and you would like to, if you want to learn something about diabetes, something about ECG, please go and visit our store. Thank you. Thank you very much.
Actually, at the beginning of the lecture, he told every lifestyle disease is reversal. And it is true because I am practicing Ayurveda since 20 years and I have the same experience. So we treated critical cases of heart disease, hypertension, diabetes, like that. And Madhav Bagh is doing very well job in such type of treatment of critical cases and lifestyle diseases. So he presented a huge data of all their work since many years. And in future, wish you all the best for the Madhava from me and all of us. Thank you.
Now I request Dr. Deepankar sir to felicitate our speaker, Dr. Gurudatta Amin sir. Now I request Dr. Suryavanshi sir to felicitate our chairperson, Dr. Deepankar sir.
Now I would like to request Dr. Krishna Devkar, ATA President, Student Wing, to felicitate our session coordinator, Dr. Rutesh Damle. And Dr. Manisha Thakre. So, right from the morning, an evidence-based Ayurveda in oncology to evidence-based Ayurveda to cardiology. It was a mesmerizing experience for me that so much of data is present, and we need to present these kind of data on scientific platform so that world will know the strength of Ayurveda through these evidences. So the total session, 5 sessions are over here, and now I would like to hand over the mic to my colleague, Dr. Shilpa Revle Madam, for the further valedictory function.
Request Dr. Kunal Kamte sir, please come on the dais and एक नेपाळमध्ये कॉन्फरन्स होते त्याची थोडक्यात माहिती सर सांगतायत आपली व्हॅलिडिटी फंक्शनची तयारी होईपर्यंत रिक्वेस्ट डॉक्टर कुणाल कामटे प्लीज
सर्वप्रथम मी आयुर्वेदा टीचर असोसिएशन आपले अध्यक्ष सूर्यवंशी सर यांचा खूप आभारी आहे आणि सर्वांचा खूप आभारी आहे की अशा तऱ्हेची मी कुठल्याही टीचिंग फील्डमध्ये नाही आहे परंतु अशी कॉन्फरन्स होती ही चौथी कॉन्फरन्स आहे अतिशय नॉलेजपूर्ण कॉन्फरन्स होती ही मी डॉक्टर कुणाल कामठे ऑन बिहाफ ऑफ आयुर्वेदा प्रोक्टॉलॉजी असोसिएशन यांच्यातर्फे एक छोटीशी अनाउन्समेंट करू इच्छितो की जसं वेगवेगळ्या क्षेत्रामध्ये आपल्याला माहिती आहे की काम चालू आहे, तसं आयुर्वेदा प्रॉक्टॉलॉजी असोसिएशन ज्याचे प्रेसिडेंट डॉक्टर महेश संघवी सर आहेत, ते वास्तविकता इथं आले होते, परंतु वेळेअभावी त्यांना लवकर जावं लागलं. आयुर्वेदा प्रॉक्टॉलॉजी असोसिएशन ही प्रोक्टॉलॉजीमध्ये काम करणाऱ्या डॉक्टरांची एक असोसिएशन आहे, जी फक्त आणि फक्त प्रोक्टॉलॉजी किंवा शल्यशी रिलेटेड काम करत असते. या वर्षी पुढच्या वर्षी 2023 मध्ये आयुर कौशल्य या नावाने नेपाळमध्ये एक कॉन्फरन्स आयोजित करत आहोत. या माध्यमातून साधारणतः 4 ते 5 हजार डॉक्टरांची कॉन्फरन्स ही असेल. यामध्ये मिनिस्ट्री ऑफ आयुष किंवा इतर सर्व आपल्या ज्या काही असोसिएशन्स आहेत त्याही याच्यामध्ये सपोर्ट करत आहेत. आपल्याही असोसिएशनने त्याच्यामध्ये खरोखर सपोर्ट करावा. त्यामुळे विद्यार्थ्यांना अनेक वेगवेगळ्या पद्धतीचे मार्गदर्शन मिळेल आणि निश्चितपणे त्याचा फायदा होईल. 1, 2, 3 फेब्रुवारी 2023 या दरम्यान ही कॉन्फरन्स नेपाळमध्ये होत आहे. गव्हर्नमेंट ऑफ नेपाळ आणि APA अशा माध्यमातून ती कॉन्फरन्स काठमांडू येथील आयुर्वेद कॉलेजमध्येच होत आहे. साधारणतः 8 ते 10 हजार विविध क्षेत्रातले रुग्ण यांची पूर्णपणे ट्रीटमेंट स्टार्ट फ्रॉम पाइल्स, फिशर, फिस्टुला, पायनोडल सायनस, तसेच अग्निकर्म या 2 प्रोक्टॉलॉजी आणि अग्निकर्म या 2 कामांना प्राधान्य तिथे दिलेलं आहे. आपला सर्वांचा सपोर्ट राहावा आणि सर आपली असोसिएशन निश्चितपणे याला जोडून जर आपलं काम झालं तर खरोखरच ज्या पद्धतीने आयुर्वेद आज आपण करतो आहोत, पाहतो आहोत, ते निश्चितपणे अजूनही पुढे जाण्यासाठी मदत होईल. पुनश्च एकदा मी आयुर्वेद टीचर असोसिएशन स्पेशली राहुल सर असतील किंवा आमचे आज वासनिक सर नाही आहेत, त्यांच्या मार्फत बोलणं झालं होतं, त्यांचाही मी खूप खूप आभारी आहे. धन्यवाद.
Hello. Now moving to the very last event of this 4th national conference, which is valedictory function. For this last but not the least, that is the valedictory function event, I would like to call upon stage Dr. Rahul Suryavamshi sir, President Ayurveda Teacher Association India. Dr. Rahul Suryavamshi sir, please. Yeah. For this valedictory function, as a chief guest, I would like to call Dr. Narayan Zadhav sir, NCISM member for Board of Ethics and Registration. Dr. Narayan Zadhav sir. I would request Dr. Gurudatta Amin sir to please come on the stage, Chief Medical Officer Madhoba. I would request Dr. Manoj Chaudhary, Secretary Ayurveda Teacher Association, to please come on the stage, sir. I request Dr. Nitin Chandurkar sir, Vice President Ayurveda Teacher Association, to please come on the stage, sir. I request Dr. Pradeep Zondhare sir, Executive Member, Organizing Committee Ayurveda Teacher Association. I request Dr. Nitin Wagmare sir, Executive Member, Ayurveda Teacher Association, India. I request Dr. Dattatreya Lodhe sir. Dattatreya Lodhe sir is here. I request Dr. Sandeep Zadhav sir. Sandeep Zadhav sir is here. Okay. A warm good morning to all the dignitaries on the dais and all the participants connected with us by online and offline mode. Now, this is the time to extend sincere gratitude and appreciation of the efforts taken by the various members to make this fourth national conference one of the successful and the great event. Unconditional support, cooperation, appreciation, and help are some qualities required to make any event successful. And the members to whom we are going to call are having all these qualities. Ayurveda Teacher Association extend their sincere gratitude towards Dr. Nitin Zadhav. Dr. Nitin Zadhav, sir, is here. Dr. Nitin Zadhav. Dr. Nitin Zadhav for getting maximum registration for these conferences and supporting this effort unconditionally. I request, okay, Dr. Nitin Zadhav, sir, not here. Okay. Dr. Yogesh Kotangale, sir, is here in the auditorium. Dr. Yogesh Kotangale, sir. Yeah, I request Dr. Yogesh Kotangale, sir, to please come on the dais for taking special efforts to making this event grand and successful. And I request today's chief guest, Dr. Narayan Zadhav, sir, to please felicitate Yogesh Kotangale, sir. Small token of appreciation. Thank you, Dr. Yogesh Kotangale, sir, for your unconditional support, cooperation, and help to make this event really great. Thank you very much. Thank you. I request Dr. Pawan Gulani, sir. Pawan Gulani, sir. I request Dr. Pawan Gulani, sir, if he is here in the auditorium. Yeah. I request President Dr. Rahul Suryavanshi, sir, to felicitate Pawan Gulani, sir. Special thanks to Dr. Pawan Gulani, sir, from Ayurveda Teacher Association. Thank you very much. I like to call upon stage Dr. Sarika Sadhale, ma'am, successfully hosting the National Award Ceremony. Dr. Sarika Sadhale, ma'am, is here. But thank you, Dr. Sarika Sadhale, ma'am. Dr. Praveen Bhatt, sir, I request Dr. Praveen Bhatt, sir, to please come forward to receive the token of appreciation from our organizer committee. The day in charge for today's offline event, I request Dr. Narayan Zadhav, sir, Dr. Gurudatta Amin, sir, and Dr. Rahul, sir, to please felicitate today's day in charge, Dr. Praveen, sir, Praveen Bhatt, sir. Thank you, sir. Thank you very much. Thank you. We would like to appreciate the unconditional and financial.
I would like to request to the chief guest to felicitate the day in charge, Dr. Shilpa Revle, madam. Thank you, madam.
I would like to appreciate the unconditional financial support given by our respected and reputed sponsor. I request to call upon stage Shri Doodh Papeshwar Company Limited, representative of Shri Doodh Papeshwar Company Limited. So please, if the company's representative is here in the auditorium, I would like to request him or her to please come on the dais and receive a token of appreciation from the Ayurveda Teacher Association organizer committee. Shri Doodh Papeshwar Company Limited, all the representatives were requested to come on the dais. Thank you, because financial support is also very, very important. It can't be neglected. So special thanks to Team Dhuk Papeshwar from organizer committee. I request Himalaya Company representative of Himalaya Company. So please, team from Himalaya Company representative, please come on the dais and receive the token of appreciation from the organizer committee. I request Ayurveda Rasashala representative to please come on the stage. Ayurveda Rasashala, Pune. Thank you very much. I request TATC, the Ayurvedic Thyroid Clinic representative, to please come on the stage. TATC representative from the Ayurveda Thyroid Clinic. I request representative from Ayush Institute for Addiction Management to please come on the stage. I request Madhobag Research Center representative. I request Dr. Gurudatta Amin sir to receive this token of appreciation from the team. Thank you. All the dignitaries are requested to be seated. Thank you. Now, next awards are the awards from different categories. First category is a poster presentation. I would like to declare those awards. The third award is Dr. Sneha Reddy, poster presentation. Dr. Sneha Reddy. The second award goes to Dr. Yogesh Yadav. Dr. Yogesh Yadav, poster awards. Dr. Shweta Mari, first award goes to Dr. Shweta Mari. Okay. So, I request Dr. Nitin Sandulkar sir to accept the first award for poster presentation on behalf of Dr. Shweta Mari. The first First award in poster presentation category, Dr. Shweta Mari. Dr. Nitin Chandurkar sir is receiving the award on behalf of Dr. Shweta Mari. Now, declaration of the awards in paper presentation category. First, I would declare the awards in teacher category. The second number in teacher category for paper presentation, the second number goes to Dr. Nilesh Ingre. Dr. Nilesh Ingre. Dr. Sumedha Punge. Dr. Sumedha Punge. Dr. Sumedha Punge, yes, she's here. I request ma'am to please come on the stage and receive her award in paper presentation category. She is receiving first award. So I think we should all give a big round of applause. Please appreciate the efforts. Congratulations, ma'am. Now, awards in the student category. Second number in paper presentation category goes to Dr. Pallavi YC. Dr. Pallavi YC. Second number goes to Dr. Pallavi. First number in student category for paper presentation goes to Dr. Ankita Baranwal. Dr. Ankita Baranwal. Now I would like to declare the awards for the post-graduation thesis. The third award goes to Dr. Archana Radhakrishnan. Dr. Archana Radhakrishnan for post-graduation thesis. Third number goes to Dr. Archana Radhakrishnan. Second number goes to Dhanashri Khotkar. Dhanashri Khotkar. And first number goes to Dr. Atulya CM. Dr. Atulya CM. Congratulations to all the three members getting the awards, receiving the awards in post-graduation thesis category. Now the awards for PhD thesis. Third number goes to Dr. Mujahid Khan. Dr. Mujahid Khan. Dr. Mujahid Khan. Yeah, she is here. I request Madam to please come on the stage and receive her award. Her friend is receiving award on behalf of Dr. Mujahid Khan, so please. Dr. Nitin Wagmare sir. Dr. Nitin Wagmare sir, second number in PhD thesis. Dr. Nitin Wagmare sir. I request Dr. Nitin Wagmare sir to please come on this dais and receive his award. Dr. Nitin Wagmare sir. Congratulations, sir. I request Dr. Kiran Taulare sir. First number in the category of PhD thesis goes to Dr. Kiran Taulare sir. Big round of applause. I request Dr. Kiran sir to please come on the stage and receive his award. Dr. Kiran Taulare sir, first number in the PhD thesis category. Congratulations to all the award winners in different categories. I request the dignitaries on the dais to please be seated. Now I request chief guest of this valedictory function, Dr. Zadhav sir, to please say a few words.
Good evening, one and all. Respected chairperson, all the office bearers of ATA, Ayurveda Teachers Association, dear faculties and dear students. Now we are here to a valedictory program. First of all, I have to congratulate the ATA for organizing the successful this 4th national conference on unique topic, the evidence-based Ayurveda. On behalf of myself, NCISM, and being a faculty, being a teacher, I am among you. I heartily congratulate all this organizing committee for this successful event. And अजून महत्वाचं म्हणजे जास्त शब्द जास्त बोलायला नाहीत, कारण मी एवढं म्हणजे नेहरून गेलो इथे, कारण या गोष्टीची एवढी गरज होती. मला जेवढे जेवढे सकाळी हे लोक भेटले त्या प्रत्येकाला मी वैयक्तिक बोललेलो आहे की मोस्ट निग्लेक्टेड जो पार्ट होता आपल्या फ्रॅटर्निटी मधला, जो टीचरचा होता, मग तो गव्हर्नमेंट लेवलला असेल, एडेड लेवलला असेल, प्रायव्हेट लेवलला असेल, डीम्ड युनिव्हर्सिटी लेवलला असेल, तर तो भाग, ते शिवधनुष्य या माझ्या सिनियर लोकांनी, काही कलिग्सनी शिवधनुष्य खरंच उचललंय. मी सर्वांना असं विनंती करेन की इथे जेवढे कोणी आहेत तर त्यांचं टाळ्यांनी स्वागत करावं, कारण सगळ्या गोष्टी करायला येतात, परंतु असं ऑर्गनायझेशन करणं, कारण मी छोटे मोठे इव्हेंट ग्रामीण भागामध्ये ऑर्गनाईज करण्याचा प्रयत्न केलेला आहे, ते करत असताना एवढ्या सगळ्यांना एका ठिकाणी करणं हे खूप मोठं काम आहे. आणि सर्वांना माझा सादर प्रणाम आहे या ठिकाणी की तुम्ही या ठिकाणी हे शिवधनुष्य पेललेलं आहे. एक व्यक्ती म्हणून, एक प्राध्यापक म्हणून, आणि आज एक NCISMचा प्रतिनिधी म्हणून मी तुमच्या सोबत आहे. म्हणजे मला एवढ्याच या ठिकाणी सांगावंसं वाटतं की प्राध्यापकांचे जे काही प्रश्न आहेत तर ते प्रश्नासाठी एक प्लॅटफॉर्म तुम्ही निर्माण केलंय. त्याच्या सोबत आयुर्वेद शिक्षणाचं पण तुम्ही काळजी घेताय आणि त्या सोबत विद्यार्थ्यांची पण काळजी घेताय. आपण अविरत ते काम तिकडे करतोच आहोत बिंग प्राध्यापक म्हणून, परंतु या प्लॅटफॉर्मवर सुद्धा हे सगळे प्रश्न तुम्ही घेऊन आलात आणि सगळे शासकीय लेवलचे लोक या ठिकाणी आणलात. त्याबद्दल मी तुमचं मनपूर्वक अभिनंदन करू इच्छितो आणि तुम्हाला भविष्यामध्ये शुभेच्छा पण देऊ इच्छितो की अशाच प्रकारचे कार्यक्रम आपल्या पूर्ण देशभरामध्ये आपण ATA घेईल याची मला गॅरंटी आहे. तर या ठिकाणी मला याबद्दल बोलवलात, एक तुमच्यातलाच प्राध्यापक म्हणून माझा सन्मान केला आणि या ठिकाणी पुन्हा अजून या सेशनला पण बोलवला, त्याबद्दल खरंच मी माझ्या मनापासून हृदयापासून धन्यवाद देतो. आणि एक 2 गोष्टी फक्त सांगणार आहे. त्यामध्ये एक गव्हर्नमेंट ऑफ इंडियाची स्कीम येत आहे, आपण ऐकलीच असेल सगळ्यांनी, हील इन इंडिया अँड हील बाय इंडिया. तर आपल्या आदरणीय पंतप्रधान साहेबांनी मागच्या एप्रिलमध्ये जे GCTM झालं, ग्लोबल सेंटर फॉर ट्रॅडिशनल मेडिसिन इन जामनगर, त्या ठिकाणी अनाउन्समेंट केली होती. आणि तीच मला इथे पुनरावृत्ती करून द्यायचे, माझ्या लोकांना सांगायचंय की येणारं दशक हे आयुर्वेदाचं दशक आहे आणि ट्रॅडिशनल मेडिसिनचं दशक आहे. म्हणून आपल्याला त्या दृष्टीने प्रयत्न करायचे, इंडस्ट्री लेवलवर, एज्युकेशनच्या लेवलवर, विद्यार्थ्यांच्या लेवलवर, ऑर्गनायझेशनच्या लेवलवर. तर एक नवीन स्कीम येते, हील बाय इंडिया आणि हील इन इंडिया. तर त्यामध्ये महत्वाचं म्हणजे मेडिकल टुरिझम. आपल्याला सर्वांनाच माहित आहे आणि त्यातही स्पेशली वेलनेस टुरिझम, त्यासाठी गव्हर्नमेंट कालच्या याच्यामध्ये अनाउन्समेंट झालेली आहे की आयुष मार्ग आणि आयुष विजा, जर बाहेरचे लोक आपल्याकडे ट्रीटमेंट घेण्यासाठी इच्छुक असतील तर त्यांना गव्हर्नमेंट ऑफ इंडिया स्पेशली या नावाने विजा पुरवणार आहे, आयुष विजा नावाने. आणि आपला जो प्रश्न आहे महत्वाचा, जो आपण म्हणतो ड्रग स्टँडर्डायझेशनचा, तर आयुष मार्क ऑथेंटिक ड्रग स्टँडर्डायझेशन गव्हर्नमेंट ऑफ इंडिया कडून त्या ड्रगला स्टँडर्डायझेशनचं मार्क्स देणार आहे आणि त्याच्यानंतर मग ह्या गोष्टी पुढे चालणार आहे. तर इव्हन प्रायव्हेट सेक्टरमध्ये जे कोणी बांधव काम करत असतील तर त्यांनी जर आपलं क्लिनिक NABH अक्रिडेट केलं, मग ते OPD बेसिसवर असेल, IPD बेसिसवर असेल, तर त्यांच्याकडे सुद्धा ते काही सेंटर्स हे करणार आहेत, लोकेट करणार आहेत, त्यांचं ट्रेनिंग पण होणार आहे. इव्हन NABH नॉर्म्स, जे काही स्ट्रिक्ट नॉर्म्स असतील ते पण थोडेसे शिथिल होणार आहे. आणि जे कोणी प्रॅक्टिशनर प्युअरली आयुर्वेद प्रॅक्टिस करत असतील तर त्यांच्यापर्यंत, आता पुण्यात भरपूर आहेत प्रायव्हेट प्रॅक्टिस करणारे, तर त्यांचे क्लिनिक्स त्यांनी हे करतील, सर्टिफाय करतील आणि त्या ठिकाणी जे कोणी फॉरेनर्स येथील ट्रीटमेंट घ्यायला त्याची व्यवस्था होणार आहे. तर ह्या पद्धतीची स्कीम हिल इन इंडिया अशी येणार आहे. नेक्स्ट प्लीज. तर याच्यामध्ये नेक्स्ट एक हिल बाय इंडिया ही अशी स्कीम आहे की सध्या IT जगावर जसं राज्य करतं इंडियन IT, तशाच पद्धतीनं वेलनेस आमचे विद्यार्थी, आमचा प्रॅक्टिशनर वेल इस्टॅब्लिश्ड होऊन इन ऑल रिस्पेक्ट, टेक्नॉलॉजी, लँग्वेज, ज्या देशात तुम्हाला प्रॅक्टिस करायची आहे तिथले सगळे नॉर्म्स, या सगळ्या गोष्टी गव्हर्नमेंट पुरवणार आहे आणि तुम्ही तिथे जाऊन ऍज अ प्रॅक्टिशनर म्हणून प्रॅक्टिस करू शकता. तर त्याच्यासाठी नेक्स्ट प्लीज, जवळपास नेक्स्ट प्लीज, नेक्स्ट प्लीज, पुढे अजून पुढे, नेक्स्ट नेक्स्ट. मी पूर्ण काही सांगत नाही कारण वेळ खूप कमी आहे, फक्त महत्वाच्या 2 गोष्टी सांगतोय. नेक्स्ट प्लीज. हा, आतापर्यंत मिनिस्ट्री ऑफ आयुषनी मेमोरँडम ऑफ अंडरस्टँडिंग 25 कंट्रीज मध्ये केलेले आहेत, 23 MOU केलेले आहेत आणि 13 MOU सेटिंग फॉर आयुष अकॅडमिक चेअर्स. म्हणजे आज ग्लोबल लेवलला एवढ्या कंट्रीमध्ये आपल्या मिनिस्ट्री ऑफ आयुषचं काम चालू आहे. आणि जर बाहेर म्हणजे ब्राईट फ्युचर साठी जर लोक विचार करत असतील आपले, एवढ्या देशामध्ये आपल्या प्रॅक्टिशनरला गव्हर्नमेंट ऑफ इंडिया थ्रू त्यांचं जे काही असेसमेंट असेल त्या पद्धतीनं जाऊन एवढी खूप मोठी महत्वाची संधी उपलब्ध करून दिलेली आहे. तर फक्त तेवढंच NCRC तर्फे सांगण्यासाठी मी या ठिकाणी उभा आहे. तर या गोष्टीचं वेबसाईटवर पूर्ण हे होणार आहे पुन्हा मिनिस्ट्रीच्या, तर आपण त्याला कॉन्टॅक्ट करून त्या पद्धतीने आपण स्वतःला डेव्हलप करून, स्किल वाढवून, टेक्नॉलॉजीचा वापर करून आपण त्या ठिकाणी जाऊ शकतो. तर या अशा पद्धतीने ह्या 2, एक हिल बाय इंडिया आणि हिल इन इंडिया. हिल इन इंडिया आपल्याकडे प्रॅक्टिस म्हणजे लोक प्रॅक्टिशनर असतील आणि करन्सी, फॉरेन करन्सी वाढवण्यासाठी हा प्रयत्न आहे. आणि आपल्या लोकांना हिल बाय इंडिया, आपले इंडियन आयुर्वेदिक स्पेशालिस्ट किंवा आयुष स्पेशालिस्ट तिकडे जाऊन तिकडे प्रॅक्टिस करतील. तर ह्या 2 महत्वाच्या स्कीम्स बद्दलचं जस्ट इंट्रोडक्टरी माहिती आपल्याला द्यायची होती. तर ते आपण या ठिकाणी केलेली आहे. आणि एक फक्त 2 मिनिटासाठी नेक्स्ट प्लीज. अजून एक महत्वाची गोष्ट आहे, इथं मला योग्य वाटतं सांगणं ऑर्गनायझरच्या परवानगीनं, की वर्ल्ड आयुर्वेद काँग्रेस एक आहे 9वं गोव्याला, त्याचं एक महाराष्ट्राचं कोऑर्डिनेटर म्हणून मला अशी एक विनंती करायची आहे की आपल्या मॅक्झिमम प्राध्यापकांनी, मॅक्झिमम रिसर्चर्सनी त्या प्लॅटफॉर्मला अटॅच व्हावं, कारण ग्लोबल प्लॅटफॉर्म आहे. आणि अजून एक महत्वाची गोष्ट म्हणजे मिनिस्ट्री ऑफ आयुष म्हणजे तयार झाली तर या ब्रेन, या लोकांच्या माइंड मधून आलेलं ते एक महत्वाचं पाऊल आहे. आणि मागच्या जवळपास 10 वर्षापासून मी त्याला अटॅच आहे. मी बऱ्याच गोष्टीचा साक्षीदार आहे की मिनिस्ट्री ऑफ आयुष तिथं झालेला आहे. आणि मला अजून एक विनंती करायची आहे की अशा पद्धतीने जेव्हा भारत सरकारमध्ये मिनिस्ट्री आहे, तशीच आपण आपल्या सगळ्या फोरमच्या माध्यमातून, कारण तुम्ही सगळ्या फोरम्सला घेतलेलं आहे, याच्यावर मी ऐकलं सगळ्या फोरम्सचे नाव वगैरे घेतलेले आहेत आपण, तर या सगळ्यांच्या मदतीनं जर पॉसिबल झालं तर महाराष्ट्रामध्ये सुद्धा आयुष मिनिस्ट्री व्हावी अशी आपली एक विनंती आहे. तर त्यासाठी आपण प्राध्यापकांनी सुद्धा प्रयत्न करावे. सकाळी मला सावरीकर सरांसोबतही मी चर्चा केली त्याबद्दल. थोडस दिल्लीमध्ये चर्चा चालू आहे आमच्या लेवलला. तर आपण महाराष्ट्रामध्ये जर ते झालं तर त्यामध्ये एज्युकेशन आणि पब्लिक हेल्थ हे जर आपला भाग वेगळा पडला आपला, तर निश्चित काही ना काही आमच्या विद्यार्थ्यांना आम्ही बिंग अ टीचर ते पण एखादी करिअरच्या संदर्भामध्ये आपण देऊ शकू. तर त्यासाठी पण आपण प्रयत्न करावेत अशी मी तुम्हाला विनंती करतो. नेक्स्ट प्लीज. नेक्स्ट प्रेझेंटेशन. फक्त एक 2 मिनिटाचं आहे. 9th तर ही 9वी वर्ल्ड आयुर्वेद काँग्रेस गोव्याला होत आहे. याच्या अगोदर 8 झाल्या, फक्त मागे कोविडमुळे त्या स्टॉप झाली होती. नेक्स्ट प्लीज. तर हे खूप मोठं ग्लोबल प्लॅटफॉर्म आहे. 2002 पासून चालू आहे आणि दर 2 वर्षाला होत असतं. आपली सेकंड इथं पुण्यामध्ये झाली होती. बऱ्याच लोकांना माहिती असेल ते. नेक्स्ट प्लीज. नेक्स्ट प्लीज. नेक्स्ट. नेक्स्ट प्लीज. ही आहे फोकल थीम आहे आयुर्वेदा फॉर वन हेल्थ. तर याच्यावर इव्हन म्हणजे आयुर्वेदाचा जो कम्प्रेहेन्सिव्ह होलिस्टिक अप्रोच आहे तर त्यावर ही थीम आहे या वर्षीची, आयुर्वेद फॉर वन हेल्थ. नेक्स्ट प्लीज. इथे प्रपोज्ड प्लेनरी सेशन्स खूप महत्वाचं आपल्यासाठी खूप महत्वाचं सेशन आहे. एज्युकेशन रिफॉर्म्स इन द लाईट ऑफ NEP नॅशनल एज्युकेशन पॉलिसी. तर ही आपल्याशी रिलेटेड आहे. मी सर्वांना विनंती करेन त्याबद्दल पेपर्स असतील तर आपण पाठवावे त्या ठिकाणी. आपल्याला काय अपेक्षित रिफॉर्म्स आहेत आपल्या सिस्टीम मध्ये एज्युकेशनच्या. बिंग अ टीचर्स असोसिएशन, बिंग अ फॅकल्टी, आपले जे काही व्ह्यूज असतील पेपर्स असतील तर या एक पूर्ण सेशन आणि विशेष म्हणजे ऑल ओव्हर भारतामधनं आणि हे NCISMचं सेशन आहे आणि पूर्ण प्रिन्सिपल्सला इन्व्हाइट करायचं चाललंय त्या ठिकाणी. या ठिकाणी कंपल्सरी प्रिन्सिपल्स असतील आय थिंक. तर त्यासाठी हे सेशन आपल्यासाठी खूप महत्वाचं आहे. येस सर, येस सर. मी बोलतो आता गेल्यानंतर दोन्ही ठिकाणी बोलतो सर. येस सर, येस. येस सर. निश्चित मी बोलतो सर. निश्चित. तर हे प्रपोज्ड सेशन्स आहेत. पॅन्डेमिक लेसन्स फॉर फ्युचर आयुर्वेद रिसर्च इनोव्हेशन्स, त्याच्यानंतर एन्व्हायरमेंटल फुटप्रिंट्स ऑफ आयुर्वेद आणि इन्व्हायटेड लेक्चर्स आहेत. नेक्स्ट प्लीज. आणि हे पूर्ण थीम्स फॉर ओरल प्रेझेंटेशन ही 16 थीम्स आहेत. मला वाटतं मला जेवढे कॉन्टॅक्ट मध्ये आहेत पूर्ण ठिकाणी मी ते पाठवतो आहे. आता टाइम कमी असल्यामुळे फक्त जस्ट अनाउन्समेंट आहे. जर कोणाला काही अडचण असेल, बिंग द कोऑर्डिनेटर ऑफ महाराष्ट्र, तुम्ही मला कॉन्टॅक्ट करू शकता. नंबर आहे सरांकडे वगैरे. फक्त बस एवढंच मला या ठिकाणी सांगायचं होतं. तर आपण सर्वांनी अजून एकदा या ठिकाणी मला संधी दिल्याबद्दल, तसेच खूप चांगला प्रोग्राम आणि सगळ्यात महत्वाचं सुरुवातीला आपल्या म्हणजे प्राध्यापकांसाठी केलेलं असोसिएशन आणि त्यांच्या कामाचं अप्रिसिएशन हे खूप चांगल्या पद्धतीने आपण केला. त्याबद्दल सर्वांचं मनपूर्वक अभिनंदन आणि आभार. धन्यवाद. जय आयुर्वेद.
Thank you, sir. And really very well said. To organize successful event on national level is a really mammoth task. And entire Ayurveda Teacher Association organization team really deserves the appreciation from all of us. Now I request Dr. Gurudatta Amin sir to please exchange his few thoughts with the audience.
सो बेसिकली आता सरांशी बोलत होतो त्यावेळी 14चा कार्यक्रम मी ऑनलाईन अटेंड केला होता आणि 14चा कार्यक्रम ऑनलाईन अटेंड केल्यानंतर मला जाणवलं की दिस इज व्हॉट द म्हणजे टीचर्स असोसिएशनच्या लोकांना खरोखर पूर्ण 360 डिग्री आयुर्वेदाची माहिती आहे. हे तुमचे जे काही तुम्ही काय म्हणतात सब्जेक्ट ठरवले होते ना, त्यातूनच कळत होतं की व्याप्ती एखाद्या विषयाची किती आहे मोठी आहे. त्यामुळे टीचर असोसिएशनच्या या उपक्रमाला हार्दिक अभिनंदन देतो आणि आम्हाला बोलवलं त्याबद्दलही आभार. आणि अशाच पद्धतीने पुढे हे काम मोठं होत राहावं, अजून जास्त इव्हेंट तुम्ही ऑर्गनाईज करा अशी विनंती करतो. आणि हॉल पूर्ण भरलेला राहील आणि मी सुद्धा तुमच्यामध्ये कुठे ना कुठेतरी मदत कायम करत राहील अशी होईल. धन्यवाद.
Thank you, Dr. Amit sir, for the appreciation. Now I request President Ayurveda Teacher Association, Dr. Rahul Suryavanshi sir, to please share his views.
Thank you. Respected dignitaries on the dais, Dr. Narayan Jadhav, NCSM member, Dr. Gurdat Amin, marketing head, manager of the Sani Madhavak, our backbone of the Ayurveda Teachers Association, Dr. Manoj Chaudhary sir, Vice President, dynamic personality, Dr. Nitin Tandurkar sir, Dr. Nitin Wagmare, who is running since 3 days for only for the certificates, Dr. Pradeep Kumar Jodhare sir, and all my respected colleagues, our committee members, Ayurveda Teachers Association, National Committee, that is Shidisha Shinde ma'am, Nitin Wagmare, Rameshwar Pawar, Ravi Srivastav, Anand Madgundi sir, सोलापूरची टीम आमची आताच जस्ट डिपार्चर झाले, त्यांना सोलापूरला पोहोचायचं होतं. खरंच ज्यावेळी आम्ही प्रत्येक वर्षी आम्हाला मार्च एप्रिल महिना आला की लोकांची विचारणा चालू होती की तुमची ऑगस्टची कॉन्फरन्स कधी आहे, 14, 15, 16 हे सगळ्यांना तारीख जवळ माहीतच होऊन गेलेली की 15, 16ला आयुर्वेद टीचर्स असोसिएशनची कॉन्फरन्स असणार आहे. त्यामुळे विचारणा चालू होते आणि तिथून आमचा प्रवास ऍक्च्युअली चालू होतो. एप्रिल मे पासून आम्ही ठरवायला चालू करतो की टॉपिक काय असेल, स्पीकर्स काय असेल. ऑनलाईन आमच्या वर्चुअल मीटिंग्स असतात. आमची नॅशनल बॉडी, महाराष्ट्र बॉडी त्याच्यामध्ये पार्टिसिपेट करतात, त्या ठिकाणी बसलेले सगळे. त्यातून आम्हाला स्पीकर्स सजेस्ट केले जातात. जवळजवळ आता बघता तुम्ही केरळाचे स्पीकर होते, कर्नाटकचे स्पीकर होते, अगदी युपी, बिहार, इव्हन ओरिसाचे काही स्पीकर होते. त्याच्यातून ऑल ओव्हर इंडियातून जे काही चांगलं आहे ते आम्ही या ठिकाणी स्टुडंटसाठी, टीचर्ससाठी, रिसर्चसाठी देण्याचा प्रयत्न करतो. हे शिवधनुष्य पार पडताना मी खरंच आमचे सेक्रेटरी डॉक्टर मनोज चौधरी, जे बॅकबोन म्हणण्यामागचं कारण जे आहे की जो बॅकबोन म्हणजे बॅकचा, खरंच म्हणजे व्हर्टिब्रल कॉलम आपल्याला नसेल तर पॅरालाइज होऊन जाईल ना आपण. सेम कंडिशन आहे की जो व्हर्टिब्रल कॉलम ताणून ठेवण्याचं काम जे आहे संघटनेचं, टिकून ठेवण्याचं काम आहे ते डॉक्टर मनोज चौधरी सर, त्यांचा खरंच मी आभारी आहे. या ठिकाणी मी ऍक्च्युली प्रेसिडेंट आहे, पण म्हणतो ना डॉक्टर मनोज चौधरी आणि नितीन चांदूरकर माझ्या मोठ्या भावाप्रमाणे आहेत की मी सगळ्यात लहान आहे वयाने, पण जे माझा जोश आणि त्या सगळ्यांचा जो अनुभव आहे तो या ठिकाणी काम करतोय आणि एवढं मोठं काम उभा राहत आहे. खरंच हे सगळे मला कधीच मला म्हणले अरे राहुल श्री सर तुम्ही छोटे आहेत किंवा तुम्ही ज्युनियर आहेत, आम्ही तुमच्या नेतृत्वाखाली कसं काम करू, हा सगळ्यांचा मोठेपणा आहे. पण आम्ही नक्कीच जे आता योगेश कोटांगले सर थोडं बसलेले आहेत, पतंगे सर आहे, सुजाम गडगड आहे, सगळेच आमचे जे टीम आहे ती काम करताना बघतोय की प्रत्येक जण, आता संदीप जाधव सर अमरावतीचे गेले, गाडी असल्यामुळे बऱ्याच जणांचे 5-6च्या डिपार्चर होतं. सगळेजण जेवढं जमल तेवढं 100% काम करतात. मी म्हणजे फोन केला की पहिल्यांदा सर अध्यक्ष महोदय सांगा काय अध्यक्ष आहे. खरंच या सगळ्यांचा माझ्यावरचा विश्वास आहे, आपल्या असोसिएशनवरचा विश्वास आहे हा. त्याच्यामुळे आपण हे एवढं मोठं शिवधनुष्य उभा करतोय. ज्यावेळी कॉन्फरन्स घ्यायचं ठरलं त्यावेळी एव्हिडन्स बेस्ड आहे ही आयडिया चौधरी सरांनी मांडली, आम्ही मीटिंग मध्ये ठेवली, मीटिंग मध्ये सगळ्यांनी सँक्शन केलं. त्यावेळी हा इव्हेंट ग्रँड इव्हेंट करायचा हेच आमच्या डोक्यात होतं आणि माझ्या मते तो इव्हेंट ग्रँड इव्हेंट झालेला आहे. आमच्या डोक्यात जेवढं होतं त्यानुसार झालेला आहे. जवळजवळ 1,500 रजिस्ट्रेशन, 350 पेपर प्रेझेंटेशन. या दरम्यान हर्डल्स जे आहेत ते भरपूर हर्डल्स होते. मी स्टेजवरती जास्त सांगणार नाही, भरपूर हर्डल्स होते, तरी सुद्धा एवढा मोठा तुफान रिस्पॉन्स बघता हा सगळा जो आहे तो आयुर्वेद टीचर्स असोसिएशन वरचा हा विश्वास आहे. त्या विश्वासामुळेच लोक, केरळमधून जवळ 50 ते 60 पेपर पोस्टर होते. तामिळनाडूमधून बरेच मला फोन आलेले की सर वी वॉन्ट टू जॉईन ATA. म्हणजे आमचे जसे मेल्स जात होते, जे मेसेज सर्क्युलेट होते तसं सगळीकडून आम्हाला, आणि जिथं जिथं आम्ही स्पॉन्सरशिपसाठी शब्द टाकतो तिथं कोणी आम्हाला नाही म्हटलं नाही. म्हणजे दॅट शोज ट्रस्ट ऑफ द एटीए, पॉवर ऑफ द एटीए आणि इनॉग्रेशन सेरेमनीसाठी डॉक्टर तनुजा नेसरी मॅम होत्या. त्यांनी सुद्धा आम्हाला नेहमी सपोर्ट केलेला आपल्या रिसर्च इन आयुर्वेद या कॉन्फरन्ससाठी होत्या. त्यानंतर डॉक्टर श्रीकांत देशमुख सर इनॉग्रेशन सेरेमनीसाठी होते. डीन की ज्यांनी नेहमीच आम्हाला युनिव्हर्सिटीमध्ये IIT ज्या काही कॉन्फरन्स असतात त्यावेळेस सपोर्ट करतात. सेंटर युनिव्हर्सिटी ऑब्झर्वर डॉक्टर हेमलता जळगावकर मॅम, त्यांनी सुद्धा 3 दिवस खूप चांगलं काम केलं, आम्हाला चांगला सपोर्ट केला, कोऑपरेशन केलं आणि फ्रेंडली अगदी सगळ्या गोष्टी झाल्या. त्याबद्दल मी त्यांचा सुद्धा आभारी आहे. आजच्या प्राइज डिस्ट्रीब्युशन सेरेमनीसाठी प्रमुख पाहुणे आपल्या VC मॅम, रिटायर्ड लेफ्टनंट जनरल डॉक्टर माधुरी कानिटकर मॅम. त्यांच्या एवढं बिझी शेड्यूल होतं, पण आपल्या एका रिक्वेस्टसाठी मॅम मी त्यांचं बिझी शेड्यूल करून मला 12:50 टाइम दिला. एक्झॅक्ट आमची तारीखेवरची कसरत चाललेली, 12:50 टाइम कसं मॅच करायचं. आणि खरंच मिरजकर सर आहेत, दिजीशीलचे आमचे दीपन मेहता आहेत, या सगळ्यांनी अतिशय मेहनत करून चांगलं मॅमचं VC मॅमचं नाशिकमध्ये बसून ऑल ओव्हर इंडिया या ठिकाणी मॅमचं जे मनोगत होतं ते लागू केलं. आणि मॅमनी खरंच 10 ते 15 मिनिटं तब्बल रिसर्च, आयुर्वेद आणि इंटरडिसिप्लिनरी या गोष्टीबद्दल, इंटिग्रेटेड गोष्टीबद्दल सर्वांना मार्गदर्शन केलं. त्याबद्दल प्रो VC सर आपल्या आयुर्वेदाचे फॅकल्टी होते, ते स्वतः इथं आले आणि त्यांनी खरंच म्हणजे काल रात्रीच आले, पण सकाळपासून 11 वाजल्यापासून तब्बल 3:30 ते 4 वाजेपर्यंत ह्या इकडचा माहोल बघितल्यानंतर सर स्वतः 5 ते 6 तास थांबले, सगळ्या टीचर्सची इंटरॅक्शन केली. डॉक्टर श्रीराम सावरीकर सर ज्यांनी आम्हाला नेहमीच सपोर्ट केला, आयुर्वेद टीचर्स असोसिएशन स्थापनेपासून एक चांगलं कार्य उभा राहत आहे आणि नेहमीच आमच्या कौतुकाची थाप दिली आमच्या पाठीवरती. डॉक्टर सुरेश पाटणकर सर, मी म्हटलं माझ्या ह्याच्यामध्ये प्राइज डिस्ट्रीब्युशन सेरेमनीमध्ये सांगितलं सरांनी आयुर्वेद म्हणलं की स्वतःहून सर म्हणले की मी रिसर्च इन आयुर्वेदासाठी येणार. आणि 2 दिवसामध्ये त्यांना फोन करून सांगितलं सर 11 वाजता या कार्यक्रमात सर राहुल कुठं सांगितलं तर मी येतो, काळजी करू. आयुर्वेदाचा कार्यक्रम आहे, 100% तू तुझ्या कार्यक्रमाला येतो. त्यानंतर डॉक्टर सुभाष रांडे सर, सुनंदा रांडे सर ते सुद्धा या ठिकाणी आले. पाळेकर सर ज्यांना आम्ही जीवनगौरव पुरस्कार दिला, सावरीकर सरांना जीवनगौरव पुरस्कार दिला आणि तब्बल 125 लोकांना आम्ही या ठिकाणी या स्टेजवरती ॲप्रिशिएट केलेलं आहे. आणि ॲप्रिशिएट केलं की कौतुकाची थाप मिळाले की हेच लोक पुढं आयुर्वेदासाठी काम करत राहतात. हा आमचा उद्देश आहे क्वालिटी एज्युकेशनसाठी, तो या ठिकाणी सफल होतोय. आणि खरंच माझ्या टीमचा मी आभारी आहे की प्रत्येक वेळी शिवधनुष्य उचलायचा मी योजतोय आणि खरं ताण जो आहे तो त्यांच्या डोक्यावर पडलेला असतो. मी कल्पना मांडतो एवढं मोठं शिवधनुष्य उभा राहायचं आणि ताण सगळं ऍक्च्युली मनोज चौधरी सर, नितीन वाघमारे सर, आमचे तांदुरकर सर, चौधरी सर, योगेश कोटांगले सर, पवन गुलाने, योगेश कोटांगले, पवन गुलाने सरांचं विशेष कौतुक. तब्बल 350 पेपर पोस्टर प्रेझेंटेशन त्यांनी 2-3 दिवसात कव्हर केले. ज्योती गवळी मॅडम, देवकाते मॅडम, कीर्ती भाटे मॅम त्यांनी दोन्ही सन्मानपत्र तयार केले. अगदी ऐनवेळी कोणालाही अगदी काम झालं. देवकाते मॅम आज ऑडिटोरियम मध्ये आले आणि म्हटलं VC मॅम साठी मॅम मेसेज तयार करायचा आहे, लगेच 2 मिनिटात मॅम लगेच करून दिल्या, लगेच 5 ते 10 मिनिटात. म्हणजे ज्या व्यक्तीला मी विश्वासानं सांगतोय की सर मॅम हे करायचं आहे, कधी कोणी मला म्हटलं नाही सर मी कसं करू किंवा काय करू किंवा काय. ही जे ATA मध्ये एक फॅमिलियर वातावरण तयार झालंय, विश्वास तयार झालाय, हा असाच टिकून राहावा तर नक्कीच आयुर्वेद टीचर्स असोसिएशनचे जे उद्देश आहे क्वालिटी एज्युकेशन, वेलफेअर ऑफ आयुर्वेद टीचर्स, स्टुडंट्स अँड ओव्हरऑल फ्रॅटर्निटी हे नक्कीच सक्सेसफुल होणार. पुन्हा एकदा आणि स्पॉन्सरशिप ज्या आहेत, दूध पापेश्वरचं मला विशेष कौतुक वाटतंय की मी पुराणिक सरांना फोन केला, 1 दिवस झाला, दुसऱ्या दिवशी एक तासाभरात सरांचा रिटर्न कॉल, बोला सुनील सर, सर असं आहे मागच्या वेळी आपण स्पॉन्सरशिप. लगेच सर म्हणले काय काळजी करू नका सर, तुम्हाला मी स्पॉन्सरशिप मिळून जाईल. मी म्हटलं सर फॉलोअप घ्यायचा का? तुम्ही फॉलोअप घेऊ नका, माझा मेल येऊन जाईल तुम्हाला, डायरेक्ट तुम्हाला चेक काढलेला किंवा हे येऊन जाईल. सेम रस शाळेबद्दल डोईपुडे सर सुद्धा आम्हाला नेहमी सपोर्ट करतात. इव्हन मागच्या कॉन्फरन्सला आम्ही त्यांना जीवनगौरव पुरस्कार दिला, त्यामुळे आम्ही स्पॉन्सरशिप मागायला गेलो नाही. बरोबर नाही, म्हणजे अवॉर्ड पण द्यायचं, स्पॉन्सरशिप मागायची. पण तरी सुद्धा सरांनी आमची कॉन्फरन्स झाल्यानंतर आम्हाला बोलवून घेऊन तुमचा जे काय होता स्पॉन्सरशिपचा, म्हणजे हे प्रेम आहे लोकांचं की तुम्ही प्रामाणिकपणे काम करताय, ही एक पावती आहे. हिमालयाने सुद्धा आम्हाला सपोर्ट केला. आमचे मित्र डॉक्टर विक्रांत पाटील सर यांना सुद्धा सांगितले एका शब्दावर थायरॉइड संदर्भात माझं जे आहे मी स्टॉल घेतो. डॉक्टर तांबार यांनी सुद्धा त्यांचा जो व्यसनमुक्ती आयुष व्यसनमुक्ती सेंटर आहे त्याचा सुद्धा स्टॉल एका शब्दावर, म्हणजे कुणी आतापर्यंत जेवढी मी नाव दिली कोणीही काबू केलं नाही, मला स्वतःला फॉलो कुणालाच घ्यावं लागलं नाही. दॅट शोज that trust on us. त्यामुळे ही जी टीम काम करते त्या टीमवरती असाच सगळ्यांचा विश्वास राहू दे एवढं बोलतो. शिल्पा रेवले मॅम, प्रवीण भट, खरंच या दोघांचं आज सकाळ दिवसभर खूप धावपळ झालेली आहे. त्या दोघांनी सुद्धा सकाळी 8:30 वाजल्यापासून मी म्हणेन ते आता 6:30 पर्यंत धावपळ खूप केली, त्याबद्दल मी त्यांचा सुद्धा आभार आहे. थँक्यू डेलिगेट्स, स्पीकर्स मी विशेष आभार मानेन की ज्यांनी वेळात वेळ काढून आपल्या असोसिएशनच्या कॉन्फरन्ससाठी वेळ दिला. चेअरपर्सन, को चेअरपर्सन, सेशन कोऑर्डिनेटर्स आणि सगळे डेलिगेट्स, थँक्यू सो मच.
Thank you, Dr. Suryavanshi sir. I request Sri Niraskar sir, DG Shield Tech for technical support. Sri Niraskar sir is here.
Yes. Hello.
I request Sri Niraskar sir to please come on the stage and request Dr. Manoj Saudhari to please felicitate Sri Niraskar for the technical support. He is a representative from DG Shield Technical Private Limited. Sri Niraskar sir. Thank you. In all the lectures from morning, we heard very good experienced experts and enjoyed the intellectual feast. All scientific sessions was delivered in coordination with the theme of today's 4th National Conference, which is Evidence-Based Ayurveda. And as said by speakers of first scientific session, Dr. Pankaj Manjarkhed sir, that with such kind of interactions and the Vidya Sambhasha, we will definitely move from nowhere to now here. So on this beautiful note, I would take a leave as a day in charge of this 3rd day of this national conference and request and invite Dr. Pradeep Zondhare sir for vote of thanks.
Very good evening, all of you. Dignitaries on the dais, Honorable Dr. Jadhav sir, our beloved President, Dr. Suryavanshi sir. May I request Kamlesh, please come on our dais. May I request Honorable President sir, please felicitate sound system in charge, Mr. Kamlakar. Kamlesh. Hello, once again, good evening. Dignitaries on the dais, Honorable Dr. Jadhav sir, our beloved President, Dr. Suryavanshi sir, our next beloved Vice President, Dr. Nitin Chandurkar sir, the backbone of our ATA. Yes. Sorry to say once again, I request Mrs. Priti Salvekar madam, please, Salvekar ma'am and his team, please come on the stage. And I request Honorable our guest, Jadhav sir, please felicitate for their all event managing very comfortably and very honestly. Please, ma'am. Give a round of applause. Every time they make very innovative our event, and really we appreciate their work. Thank you, madam. Should I start, sir? So, from our backbone of our association, Honorable Dr. Chaudhary sir, our treasurer, Dr. Balkundi sir, our working president, Honorable Dr. Durmal sir, all executive on working committee of the ATA, all respected dignitaries of the dais, and my beloved teacher and student. Vote of thanks is a very, we can say the very crucial tasks. We care of each and everything, but whatever the Jadhav sir has given the information in a short while, it is very innovative, and I am impressed as per his last work from last 15 years work. He has made very good efforts regarding the woman chikisa. Clinically, he has having very good hand, we can say. I'm really thankful. There is a very great honor for the ATA today. They are the chief guest for this our validatory function. I'm very thank you, sir. He has made his vital timing from his very busy schedule. Respected our young dynamic from the Madhav, I am today in afternoon session, I have heard his lecture and I feel that the young one having very good, he belongs to Sanhita, but it is a very honesty regarding his work, honesty regarding his knowledge. Sir, I am really very thank you, sir. Thank you very much, sir. Our anchoring, Madam, Revole Madam, then our Praveen sir, each and every members to complete this program as a, we can say the intellectual leadership program. It is a very complete package for student, teachers, upcoming peoples, HODs, some advisors, and there are a lot of committee which are, it is a very task to make their each and every name. So I am thank you for the lightman, electrician, photographer. We can say the dinner, very delicious dinner from him. I'm very thank you. Each and every Rangoli, they have made very good their job. The banner wala, the sponsors, there are a lot of companies from this Pune, out of Pune. There are a lot of delegates from throughout India. Thank you so much. If unfortunately I left, please I excuse myself and thank you once again. Thank you. With the permission of Honorable President, this program is complete here, and thank you once again. Have a nice day. You have high tea and one high tea. Yes, please stand up yourself for our Rashtragit. I request all
हॅलो हॅलो नमस्कार. Good evening, good evening. आवाज ना? गाणं आवडलं का त्याला? नाचू. हा ना? आणि काल काय बघा कसलं होतं म्हणजे actually काय सुंदर होतं ना. म्हणजे आज नाही